We're on live.
Okay. So welcome everyone to March 9th City Council meeting. And this meeting is being recorded by video and audio in accordance with the state open meeting law, consistent with the governor's order suspending certain provisions of the open meeting law and banning gatherings of more than 10 people. This meeting will be conducted by remote participation. Additionally, all votes taken by the city council during this and future remote meetings will be by roll call vote. If you are calling in on a phone, you can press *9 to request to speak. If you are watching on a computer or a device, there is a raise hand button that you can tap or press to request to speak. Please use either of these options during oral communications to be recognized to speak. In attendance this evening, in no particular order, we have Councilor Pett, Councilor LeBlanc, Councilor Memhard, Councilor McCarthy, Councilor Gilman, Councilor Cox, Councilor Holmgren, Councilor Nolan, and Councilor O'Hara. We have a full city council. Also in the meeting this evening, we have our Mayor Taken. We have our CAO, Nicole Keyser. How's that, Nicole? Better? I got it. We have our city auditor, Kenny Costa. We have our, let's see, I'm trying to look at everybody. We have our planning director, Greg Cavatori. We have our community development director, Jill Cahill. And we have our always awesome city clerk, Joanne Sinos. All right.
Chris
You
Secarenza.
also have your,
Oh, we
You
have,
have,
I don't see Chris, but oh, there's Chris. Hey, Chris. We have our assistant CAO, Chris Sicarenza.
Chris and Karen Carroll.
Yeah, we're gonna get to Karen. We have Karen, our public health agent. So this evening, Madam Clerk, can we have our next order of business, please? I'm sorry.
Next order of business is oral communications.
Okay, so I want to try to switch things around a little bit. Last time oral communications took up quite a bit of our meeting. So we have our public health agent here this evening to update us with some important COVID issues. So I'm going to ask the council if it's okay to suspend our rules. And so I will, and we'll put the oral communications further back on the agenda. So I will entertain a motion to suspend our rules.
So
So
moved.
moved.
All right.
Second.
So it's been moved by Councilor Cox and seconded by Councilor Holmgren and Gilman. So the discussion on the oral communication part of it is, where would we like to put them? Do we want to put them after the public, the presentations, or do we want to put them back further at the end of the meeting? How does everybody feel? Council, I'll start. Councilor Pett, how do you feel?
I would like to, at this point, I'd like to move them to the end of the meeting just because of what it has taken place all the time that has taken up not only from presentations, et cetera, but just for the course of the meeting. And then I'd also like to clarify, we had some issues where things were on the agenda. And even though I understand we want to listen to our constituents and we don't want to hold anything back, I also think that it's against our policy to have people making oral communications about things that may be covered on our agenda.
All right, thank you, Barry. Councilor Memhard, you in favor of moving things to the end of the meeting for oral communications? Scott, can you hear me? Can anybody else hear me? Am I on?
I can hear you.
I can hear you. Councilor McCarthy,
At this time, yes.
you okay at the end of the meeting, oral communications?
It's fine with me to move them to the end, and I agree.
Okay, Councilor Gilman,
Yeah, I will support the motion. I just want to comment that for people that are here for the fourth or fifth time in the last 3 meetings, you might want to limit your public comment to a minute or so, because we certainly have heard you loud and clear. But I think it's a good idea to make sure that we can get our important business in front of us, like hearing the COVID update from
Yeah.
our Director of Public Health.
we've got quite an agenda before this evening. Councilor O'Hara,
Thank you. I don't have a problem with it going into the future, but I think to do it at this point, I don't think is in fairness to everyone. I think noting it on the agenda in future meetings, I think is the professional way to act.
Well, we have
Thank
to
you.
vote, we have to vote on it, so, you know, we can do this at any point. We don't have to, it doesn't have to be pre-planned or on the agenda. So we can suspend our rules at any moment of the meeting. So this is how it works. You know, we can't put it on an agenda to suspend our rules. Councilor Nolan, at the end of the meeting with you also. So we're gonna make a formal motion to do this. Seems like the consensus is to move it to the end of the meeting. So I will entertain a motion to move the oral communications to the back end of the meeting.
So moved.
Second.
Moved and seconded by Councilor Cox and Councilor McCarthy. All right, Joanne, I'm sorry, I don't have the roll call in front of me. Do you have the roll call?
Scott
It's-
first.
Councilman
Yes,
Memhard.
Scott Memhard.
All right. So,
Yes.
So, okay, Councilor Memhard. Councilor Nolan,
Yes.
Councilor O'Hara,
No,
Councilor Pat,
Yes,
all right, Councilor Cox,
yes.
I'm not necessarily in favor of moving it to the end of the meeting, but that was the consensus, so yes.
okay. Councilor Gilman,
Yes.
Councilor Holmgren,
Yes.
Councilor LeBlanc, yes. So motion passes to suspend our rules and move the oral communications to the end of the
Yes,
meeting on a
Steve.
roll call vote of 8 in favor, 1 opposed. Okay. So Madam Clerk, so we will be having our oral communications at the end of the meeting. I got one other quick announcement this evening. So anybody on the call this evening for 99 Essex Avenue, we are going to withdraw this without prejudice later on in the meeting when it comes to the public hearing. So if you are here for 99 Essex Avenue expecting a public hearing, there will not be a public hearing. The applicant has asked to withdraw this without prejudice. So we will not be hearing a public hearing this evening. We will be withdrawing this in a motion, and which means that the applicant will reapply or can reapply to do something else on that spot. So we will not be hearing 99 Essex Avenue this evening. All right, Madam Clerk, can we have the next order of business, please?
The next order of business is the first presentation from Karen Carroll, Public Health Director, regarding COVID-19 update.
All right, Karen, how are you?
Good. Thank you, Councilor LeBlanc, and thank you for having me tonight.
Nice to have you here.
So I'll just go ahead. I can hardly believe it's been a year since we've been doing these presentations with you guys. And, you know, it's about a year ago that we had our last in-person one. So I'd like to give you a quick overview of our current COVID activity in the city right now, and then our vaccine efforts, and a little bit of a summary recap of the year, and then take any questions. So I'll try to move this along quickly, but obviously a lot of information and a lot has happened in the past year. Currently, as of 3/8/21, so last night, we had 48 active cases in the city. And we've been sitting around that 40 to 60 number for a couple of weeks now. So that's a very good sign. We have one person in the hospital. We have 41 deaths to date. And most of those, as you know, were last spring in our very high risk long-term care facilities. So many of you may be aware that the other night there was an opening at the Cape Ann Museum of a memorial for the people in Gloucester or Cape Ann who have passed away from COVID. And I was thrilled to have our contact tracing nurses be included and recognized and invited to that opening night with the mayor and other folks in the community. And just to remember that it has been, you know, it was a very painful experience for so many families in our community. And we are grateful to the support of the council, the mayor's office, that we had a team in place that could support people as much as we possibly could during those difficult times. So I encourage people to go and see the memorial, the quilt, and the wall as well. Currently, our positive test rate is a little below 3%, so right around the state level. Our wastewater virus level continues to trend downwards over the last couple of weeks, so that's a great sign. We're not able to test at this point for the new strains with the wastewater. We were hoping maybe we would be able to do that sooner rather than later, but we'll keep you updated on that. We're hoping at some point they will be able to. Our long-term care facilities are still presenting with very few cases and are doing excellent. Our schools have had very few cases. As you know, we celebrated 100 days of the schools being open with very few cases and minimal, maybe one cluster associated with the school in the entire time, which is remarkable, one very small cluster. We certainly had some clusters to do with sports and other communities that have been resolved, and people understood and followed the quarantine. And they're now moving forward with their spring season, so hopefully that'll be easier as well. And they have started their pool testing, which is fantastic. It's a free surveillance tool that schools can use to regularly monitor once a week their entire population. The other word is batch testing, which might be a little easier to understand. It's where you put a number of samples in one test tube, so you're only paying for one test. It's a quick way to survey a lot more people. And then if you do have a positive, which is very, very rare in the school settings, and we have seen that in our first few weeks as well, you go back and you test all of those people that were included in that sample. And the school can do that follow-up testing right on site, and they are. So that program is going along really well, and I commend them for their work in making that happen. And the tracing team and the vaccination team are still in place and are able to keep up with all of the requirements at hand for both of those teams. So in summary, while the overall trend continues to be positive here in both Gloucester, Cape Ann, as well as statewide, we remain cautiously optimistic. We remain concerned about some of the same things we always have been. Informal gatherings where people let down their guard. That is where our increased caseload has come from recently, is family social gatherings. So that is, as we have the whole time through, that's where we see the bulk of our cases. So we remind people to still adhere to those rules, even though our case numbers are coming down. It's still a very real situation, and we are still watching these newer, more virulent strains that have been identified in our communities in Massachusetts. So we're watching those closely as well, which leads me into our vaccination efforts, because it's kind of a race against the clock to get more and more people at high risk vaccinated, and then we will not have to worry so much about these other things. So between January and March, the City of Gloucester Health Department successfully coordinated a regional clinic of first responders with our Cape Ann and Ipswich partners, 500 first responders. We've vaccinated 280 people in the 75 plus category, an additional 220 in our new eligible and phase 1 folks. And then today and last week, we did 200 people, residents living in our affordable senior housing complexes. That went really well, and it was the first time we were on site delivering in a more mobile way, floor to floor. The residents were able to sit in their doorway, receive their vaccination from the nurse team, and then the nurses would go to the next floor where paramedics would wait on the floor with the residents and talk with them and explain things and wait the 30 minutes, 15 to 30 minutes with them. So that's gone really well, and we thank our partners at the Gloucester Housing Authority for their hard work in pulling that off. Later this month, we'll be introducing a program for homebound residents, and we'll be sharing a lot more information with you and residents as to who qualifies for that. I know, Jen, we're really thrilled. This is a very vulnerable group of people that kind of have been lost in the other options that are out there right now. So we're thrilled that the state has offered this, and we will partner with them to provide that as soon as possible. The governor's office, as you probably know, announced a few weeks back that there'll be no additional regular routine allotments to local public health departments. And this was obviously upsetting to us. We wanted to continue with this work, but I think in light of a national shortage of vaccine, it's kind of the reality that we're all faced with right now. It's very, very frustrating for our residents to not have the ability to access vaccine if they are eligible. So we understand that, and we feel their frustration too, but we'll continue to work and advocate and look for opportunities and programs that the state offers for residents, and we will be ready and able to partner with the state and administer vaccine should we be asked to. The overall goal has not changed. So when we had this little bit of a setback and reshift, our goal hasn't changed. It's still to vaccinate as many residents as want to get the vaccine and are able to. So we've just had to think differently about how it might not be us doing all of the work, but we need to partner and find access and transportation and deal with those kinds of issues to try to get that vaccination rate up. I'm really pleased to announce that as of last night, the state reported to me that 24% of Gloucester's population has been vaccinated, and 58% of our residents who are over 65 have been vaccinated. So that's extraordinary, and we're really pleased that we have such a high rate of vaccination here in Gloucester. And we are, I believe, above the state average with that. So our work is, it's different now. It's, not as many shots that we're giving, but a lot more of the education and outreach to make sure people know how to access the vaccine. So under Kelly Highland, our public health nurse, she's the incident commander for our vaccine team. We have a full incident command structure set up with our friends and partners at the fire department and the mayor's office. There's a communication component to it, and we have logistics folks and all of the different roles of an ICS chart. But they have two objectives really that they're simultaneously working on. So in many ways, Kelly's team's work has gotten even harder in that they're not just trying to figure out the logistics of putting vaccine in people's arms. That is one part of what they're doing still, and we're doing a lot of second dose clinics. And then, as I said, as programs arise that we're eligible for, we are participating in those. So we still are giving vaccine each week at this point, but we're also advocating for additional targeted vaccination programs. So as teachers become eligible, as other members of the community, as municipal workers, we would like to be able to offer the kinds of clinics we do during flu season routinely. We see this as our role moving forward for years to come. As we do with flu, we will probably also need to include COVID in our yearly vaccination efforts. And that's something the health department, as you all know, has done for many, many years. And also is, our role in local public health is to identify target populations that may have more barriers to getting to a vaccination site or to a doctor's office. So that is the work we've always done, and we will continue to do it. And hopefully as vaccine flows, we will be able to also provide vaccine. At the moment, I can tell you we are holding some conversations with our Cape Ann partners and the mayor's office, Bruce Tarr's office, to explore ways that we can partner and maybe do some work regionally here on Cape Ann, providing more access to residents of Cape Ann and Ipswich. At this point, we don't have any guarantees of anything, but we're really committed as a region to continuing to be ready and available if there are opportunities, and maybe putting forward proposals to the state that, again, as vaccine becomes available, we might have an opportunity to receive some of that. So again, the second area in which the vaccine team is really focusing their work is in this increased access to vaccine, which will require significant education, partnering, communication, outreach, logistical supports, and addressing the 3 C's, we call them, of vaccine hesitancy. So this work is very real and ongoing given the rapid nature of COVID, the disease, and the development of the vaccine. And now we have some newer vaccines that are different, they behave differently, they're administered differently. And we have a lot of questions and concerns about that. So again, it's confronting the complacency that people may feel as the pandemic starts to wind down. It's dealing with the issue of confidence that the public may feel in both the vaccine and the system of delivery. So we need to make sure people understand all of the information about the vaccine, about the efficacy of it, about how it's administered and by whom. And the convenience factor. And again, this is where public health has always come in with finding the healthy choice needs to be the easy choice. So we say this over and over again, whether it's eating or smoking or walking or receiving a vaccine if you are able and want one. So we need to find ways to address all of the barriers that people may experience to getting the vaccine. That can be education, it can be the ability to take time off of work to go and get a vaccine. It can be a ride to the vaccine. So it can be a translation, needing a translator. So all of these things, we will continue to work very hard to break down the barriers that people experience. And we've already worked a lot with our partner agencies to make sure we're addressing these. The health department has partnered with our regional senior serving and transportation agencies to secure rides. So we've done really well with this. We have plenty of rides, just nowhere to go, all dressed up, nowhere to go. But that'll come, and we are really pleased that our partners have stepped up. CADA, Senior Care, the Council on Aging, the health department's Senior on the Go bus. We have lots of opportunities and volunteers willing to take people to a vaccine site, really anywhere, if we can get appointments. So I imagine as we get more vaccine, we'll be ramping those programs up. We have 2 hotlines that we can recommend for residents. One is the Mass 211 hotline, and the other is a more recent hotline that I believe the mayor is a volunteer on as well, the Medical Reserve Corps hotline. That's a phone number that is staffed by volunteers of the Medical Reserve Corps from 7 a.m. to 8 p.m. every day. And if they don't have any vaccine, they won't answer the phone. That's how there aren't any appointments. But they've been assisting people in both accessing the state's sites for a vaccine or a local clinic if there are any. And they also are assisting us with knowing what resources we have here in Gloucester for transportation. So that's the added bonus of this MRC line, is that they will really work to ensure the person gets a ride there and they know the local resources, where the state can't possibly maintain that information for every town. So there are 2 options for people. And then of course we direct them, if they can make their own appointment, they can do that online through the mass.gov site. So given the ongoing support and funding from City Council and the administration, we have been able to maintain throughout the year both the COVID tracing and response, as well as the vaccination efforts, and respond nimbly to the ever-changing environment of COVID. In February of last year, you will remember, we established the contact tracing team as our cases started to increase. In the spring of 2020, our tracing team provided focused technical support daily to our high-risk settings, so our long-term care and our senior housing, to protect those residents that we were the most concerned about. And when I say daily, I mean several times a day. We partnered with those agencies and our nursing team to make sure they had what they needed, or we offered support in any way we could. In the spring and summer, the CTC then pivoted to assist local businesses and agencies in their reopening and following all of the state's guidelines and handling of enforcement issues, as well as the inspectional side of the department as well was heavily involved in that. And at that time, we established a clinical business liaison role for one of our nurses, and that person has changed, but the role is still there. And they assist businesses, agencies, schools, anyone with a cluster or an exposure concern or any kind of issues related to a business or agency that would involve a number of people. That's been really effective. It's again helped to break down some of the barriers of communication and identify some needs that agencies have and businesses have in order to stay open safely. In the fall of this year, we provided ongoing regular support to our schools to enable them to reopen. And again, we're so proud of the city and their effort and commitment to our kids to safely having them in school and keeping them in school. In November and January, we saw several large clusters and a steady increase in cases due to holidays, travel, and a number of other things like the rest of the state did. And our team was able to manage those and was resourced enough to do that. And in January of 2021, we began the actual vaccinations where, we had been planning prior to that, obviously, but we began to actually administer vaccine and oversee all the aspects of a vaccination effort to ensure that Gloucester residents had access to the vaccine. And as a footnote, and I think I mentioned this earlier, we fully anticipate that this role will continue and this need will remain even after our contact tracing team winds down. The need for ongoing planning and administering and education around vaccines will become more and more important and will need to continue throughout the year, the cycle of flu and COVID, and then all the preparation that goes with that. So a couple of changes coming through for vaccinated people. Many of you have heard recently the CDC has announced that once you are 2 weeks after your last dose of your vaccine, you have some freedom for a few months. And they are advising people to still continue wearing a mask, because I think the one thing we still don't really understand is the ability to transmit the virus even once you've been vaccinated. You may be able to, there may be some transmission there. So they still recommend that, if you're out and about in public, that you do wear a mask and you avoid situations where you're crowded, but that you can have a little freedom to gather indoors with other people who are vaccinated without wearing a mask, and you can gather with up to one unvaccinated family or household without masks. So there will be some additional freedoms. We heard some rules about the travel order changing today. If you are vaccinated, you will not need to test when you come back into the state. But these are all very, very new, and they haven't sort of been put into writing in our guidance that will go out to everyone in the community. So we will certainly share that as soon as the state adopts the CDC's requirements, if they do, and kind of put that out there. One of the biggest questions we're getting about all this is, does it pertain to the workforce? So if my teacher is vaccinated or a staff member in my business is vaccinated, can they not wear a mask? At this point, yes, they have to continue wearing a mask to protect everyone. And we'll see how this rolls out, and there'll be some HR discussions around it as well. But at this point, people do need to continue to wear a face covering in the workplace and the school environment, because we don't really know, who's been vaccinated, for how long, when. So we'll watch for more guidance there. I'm sure there will be some. Obviously, the state and the schools are beginning to talk about the spring and other summer, spring events that we all talked about last year in a little bit different light. And hopefully this year we'll have a different kind of spring and summer, where things that were not possible last year for safety reasons will be more possible. They won't look like the prom always used to look, but hopefully there can be activities for youth. There will be school plays and events to acknowledge and celebrate, and some of the life celebrations that we all enjoy. So again, I think my message is cautiously optimistic that we have been through a really difficult year, and that it will get better. We have vaccine. We have a really good vaccines. We have 3 of them, and we have 24% of our population already vaccinated. even with all of the scrambling and difficulty getting vaccines. So I hope it will just continue to get easier for us all, and we can continue to do the things that we want to do and love to do. So those are my main updates. I thank you again for all of your support to me and my team through the year. It's not been easy on them and many of the city departments, or you, I'm sure. But thank you, and if you have questions or concerns, I'd be happy to take them, or you can contact me after.
All right, any councilor questions? Councilor Pat?
Yes, first of all, thank you, Karen, to you and your team for all your hard work over the past year. I have two things. First of all, I'm lucky enough to be a veteran and have had received both of my shots last month through the Veterans Clinic down at Rose Baker. And I'm wondering if you had information. I know when you were going over your numbers, if you have information as to how many Gloucester veterans were inoculated at that. I know there was some that were not, say, Gloucester or whatever. I was wondering, that's my first question, is if you had any information as to the numbers on the veterans from Gloucester that were vaccinated there.
That's a great question. I don't have the exact numbers. I do know that it was a very quick clinic that was, coming fast, and we were really concerned that there weren't many people registered at first, and we thought it was a great opportunity. And then a whole lot of people did a whole lot of outreach to really get the message out to veterans throughout Cape Ann that this opportunity was here. And the final numbers were very good. They ended up doing a few hundred people, I think, at that clinic that weekend. It was fantastic. So I don't know the number for Gloucester, but I will find out and get back to you.
All right, Councilor Pat, is that it?
Okay, thank you. And the other thing is not so much of a question, just an update. No, just one more. Again, you had talked about your team and the financial, I know, costs involved with that, and we're all happy to support it, and thank God we're able to do so, that the city was in condition to do that. And I know that this is still ongoing, and I know there's a lot of federal support, and then through the state down to us. But I'm just wondering if you have an idea as to how long it might take, what the feeling is, or if you're having discussion with other health directors as time that might be before some of the reimbursements come. And how long will the burden stay with the city to keep these things going before the reimbursements come back? Because then I know there's some significant dollars that are involved, and we obviously need to do it. I'm 100% supportive of doing it, but I'm just wondering if you have an idea how soon some of that reimbursement, is it a year or 2 years down the line, or have you heard anything?
Yeah, again, the answer is it depends. The funding from FEMA can take a year or 2 years. So that is a significant delay, any FEMA funding. But at this point, John Dunn and folks can answer more exactly. At this point, we have received CARES Act funding as well. And I believe that comes through pretty quickly, or at least the approval of it. Here he is. And then there's also, for the COVID vaccination efforts, we're moving into a billable operation. So that will change things too. And as you know, you can't bill both FEMA and bill insurance. So, for the COVID vaccine, we are able to bill for the administration of the vaccine, that portion. And after our first few clinics, we have been able to largely break even with that. So again, it depends on the kinds of clinics we do. But the reimbursement rate is pretty good, and it's pretty quick. We get our insurance reimbursement within 3 to 6 months. So I'll let John take it from there around how fast the money comes.
Well, thank you, Karen. You've done a great job. And so we're just going to kind of keep watching this. So there's going to be some expenses that have, gone to the general fund that can be reallocated to other issues. And we're just going to keep watching. So we also have an expected amount of money that's going to be coming in this next aspect of the CARES Act. Don't know exactly what they're going to call it, but we do kind of the same thing. So Barry, in terms of your question, we will do whatever we can to offload expenses as appropriate to FEMA or the CARES Act funds, and then we will do what we're going to have to do. We're going to support whatever needs to be done within the community.
Thank you, John. Barry, you all set?
Absolutely. I was not questioning any of that. I'm just trying to get a feel for the finances. That's all.
Yep. Thank you.
Councilor Cox and then
Thank you.
Councilor Holmgren.
Hi, Karen. Great to see you. Just curious how the state knows what percentage we're at as far as vaccines. How does it get from your tabulation to the state?
The state introduced a new software system like 3 or 5 days before our first clinic. It was called PrepMod. It came out in January. It was developed very, very quickly by the state. And we were apprehensive about using it, a new product like that, so quickly getting up to speed. It's a real-time scheduling system as well as the actual vaccination, because you work clinics with us. But basically it's all in one, and this is amazing. And it's thanks to our IT director, Ryan Knowles, we were able to implement it very quickly and do pretty much just-in-time training with the nurses administering the vaccine, and the clerical folks who were registering people and greeting them and recording that they had arrived and that sort of thing. But the system, it does the front-end scheduling, but then it also, once the vaccine is administered and it's entered real time into the PrepMod system, it then goes 2 ways. The data goes off to the billing at UMass, who does our billing for us directly. So we don't have to have clerks like we used to entering the data in for each vaccine shot given. So it automatically goes off to UMass for the billing of insurance to insurance companies. And then it also goes automatically to the state's immunization database, the MIIS, which is fantastic. So that's a database where we record any immunizations that have happened anywhere in the state, and they're maintained in there. So we can very easily pull information from that system. We have the ability to run some reports ourselves, and we're getting a little bit better at that as well, trying to run reports for where we're up to in terms of our immunization rate and what age groups and all those things. So yeah, it's quite the system, and it's just there. Like as soon as that shot happens, it is in there for us to pull from. But good question. Yeah.
Just one more. I have to say that I volunteered at a clinic outside of town on Sunday, and I sent Carol a message and just told her how much I appreciated the organization that you guys have, because it was really chaotic at this one out of town, and it was just crazy. And I'm sure they were doing the best they could, but like it was just, you guys have this fine detail, and it's just a pleasure to work with you. So
thank you.
Thank you.
That's great to hear. And we do hear that. And I think that's Kelly's leadership as well. Kelly Highland, our public health nurse, is a perfectionist. And we practice these things ongoing every year. Even, sometimes it feels silly to put vests on and practice, but we do, and we take it seriously, and then things go really smoothly when we need them to. So, but thank you for that feedback. I'll pass it on.
I'm all set.
Thank you, Melissa. Councilor Holmgren.
Karen, thank you so much. I, again, don't have any questions, but every time you come before us and give us an update, you have done amazing work. I mean, the entire team has. I just, from the perspective of being a parent, in the Gloucester Public School system and watching how city administration, the health department and school administration have all worked together with staff, with parents, and with students to create safe environments is something that I really appreciate. I cannot thank you all enough. From stem to stern, we are in such good shape, and I'm looking with interest at what's going to happen after April 5th, because I understand that DESE has put forward recommendations for in-person school, but I feel that because of your hard work and everyone else's, we're in a far better position than maybe we could have been if we hadn't had such good leadership. So thank you, Karen. Thank you, Mayor Taken, and thank you, Superintendent Lummis as well.
Thank you, Jen. Councilor Nolan and Scott, did you have your hand up? Nope. Councilor Nolan and then Councilor Gilman.
Karen, thank you for all your work. Your whole team, the city, the administration, councils as a whole. I don't look at this as a budgetary item. I'm not looking for FEMA or state or federal or local. We need to achieve the objective, which is a public health safety and getting everybody inoculated and taking care of this. If it hurts down the road financially for us to have to kick in or add to, or insurance companies to give a little more, the end result is public safety. It's a pandemic. So money's not the issue. And you guys are doing a wonderful job. And I think that Gloucester is a stellar example of how things can come together with the school department and the administration and the council as well. So it's not a budgetary item to me. Don't think of it that way, Karen. You're doing a great job. Keep us safe. Thank you.
Thank you.
John, Councilor Gilman, and then Councilor McCarthy.
Thank you, Counselor. Karen, accolades, as my colleagues have all shared. You've done an amazing job, as well as your team. So my question to you is there still a service that senior care can play with helping our seniors navigate how they can get a ride up to the different locations and kind of partnering with them? The reason why I ask is I know when you call Rose Baker, they now refer you to senior care, and I was hoping you could just give us a short briefing in terms of how they can help our seniors.
Sure. Well, all the seniors serving agencies worked together to come up with some lists and then a system. And what they decided was, because senior care has more staff taking calls and they also had more programs themselves, they had the most number of transportation programs internally. So they agreed and offered to be the kind of point person for people needing a ride right now. So when, so our senior center and other agencies kind of refer to them, because we wanted one spot right now that we're referring, but they won't be able to maintain that ongoing for when we open it up to everyone. So that's one of the things we're looking at with the MRC, having a designated sort of hotline, if you like, for Gloucester residents or Cape Ann residents, that would have all of these transportation options nicely spelled out, and be able to assist people in making the appointment and then getting the ride there. So we think the logical place for that is MRC long-term, and they are more than happy to do it. So we're just kind of working out the system and what the phone number would be and how that would work. But we really feel that we've reached so many of that 75 plus, that highest risk group. We're really scratching to make sure now that we have found everyone. And once the homebound program happens, we really feel confident that most people over 75 that want it, our agencies have been in touch with them. We've found them. We're facilitating whatever they need to get that appointment. And, I can just share with you that there's lots of ways vaccine comes to the community, and you all know this, and some partners will email an invite or text an invite. And that's a fantastic system that BI Leahy has put in place. And for most people, it works great. They get their invite when they're eligible, and then they can make an appointment very easily. But we have a lot of seniors who do not have internet or a smartphone that they can text on. And we didn't know that. So, these are the things that we're discovering and fine tuning. And then we have options for those people. We help those people to make sure that they didn't miss that invite, that they just don't have the technology to receive. So those are the kinds of things, the kinds of stones that we're turning over with our partner agencies. And we have so many great volunteers and so many great staff, and they know their clients really well. The mayor's office knows a lot of these folks as well in this high risk age group. So these are where we're spending some more of our time and our energy thinking about who do we need to reach. And we're also circling back to our data about who was hardest hit by the pandemic in Gloucester. What occupations, what ages, who was hit. And there were definitely some groups, and when we look at our data, that we can see. And so it's really important that we make sure with our liaison nurse or our food inspector or whoever's worked with these people who were hit really hard, that we circle back and use those relationships that we formed and make sure that they are, have access to the vaccine or know how to access it, those kinds of things. So, we really have the time to spend on those equity issues, and that's really important to us as well.
Thank you so much.
Thank you, Bill. Council McCarthy?
Thank you, Steve. Been a long year, Karen. You've got another long year coming up. You've worked for the city for a while, so you know you have 30,000 bosses. And as being one of those 30,000 bosses, I just want to thank you for you and what all your staff has done. And as one of your 30,000 bosses, I want to give you an order that you and your staff get the rest that you need to stay physically and mentally healthy. And we thank you for everything you're doing.
Thank you very much. Yeah, thank you. I think that's part of what we appreciate when we came to the mayor's office a year ago or a year and a bit ago. And we said, and I can remember, Eric Smith and Chief Conley and Chief Fitzgerald, we had sat down in January to say, what is this thing and what are we going to need and what might it do? And we really didn't know. I think I told Chief Fitzgerald or Lieutenant Fitzgerald, I said, don't worry about it. We got to worry about flu right now. And he reminds me of that. But, then it went into January, February. We knew we needed to have the depth in our team to handle this thing that was coming. And so we appreciate that we had that support to build the team, to hire some contact tracers so that people could take a day off because, as you said, it's gone on a really long time. Yep.
All right, John, you all set? All right, Karen, thanks for being here.
My pleasure.
Dave.
Who would have thought? Oh, I'm sorry, Jamie. I forgot about you, bud. Go ahead, Jamie.
Sure, thank you. Carol, I want to thank you so much and every person involved. This was such the word pandemic. This came up, this was an issue in the CERT program when it was active. And Councilor Cox probably remembers there was many meetings dealing with pandemic. And I, for one, you heard the word pandemic and you looked and read about what was involved in a pandemic. You could not envision that such an event could happen, but it has, and you've lived it. Everyone has lived it. You've learned. Everyone has learned from it, and hopefully we don't see it again. But we, as everyone said, can't say enough the work of you and everyone involved with it. So thank you very much.
Welcome. Thank you.
Thank you, Jamie.
Thank you, counselors.
So once again, Karen, thank you. Let's plan on doing this next month, same time, first meeting of every month. We'll just have you on the agenda from here on out, unless something dramatic happens or that we need to have you before us another before our next scheduled council meeting. Yeah, but who would have thought a year ago I was on my way to a Celtics game? And it was probably the last thing that, normalcy that we had. And here we are. Hopefully we can get herd immunity and go back to normal. So, but if you do have any other information, I know Nicole has been pumping out information daily. So if anything else happens, feel free to share any information with us and we'll pass it along.
Super. Thank you. That's
Karen,
very
thank you.
helpful.
You have a good night. And if there's anything you need
Okay.
from us, give us a call.
Yep. All righty. Thanks. Good
Thanks
night.
again. Good night. All right, Madam Clerk, the next order of business, please.
The next order of business is the second presentation from Carl Ellis on the Youth Legend Street Hockey regarding update on the development of the street hockey rink at Stage 4 Park.
All right, Carl, how are you?
Doing well, Steve. Thank you, City Council members. Appreciate the opportunity to represent our team. And it's been a little while since we've seen everybody, but we've been trying to keep you guys in the loop as much as possible. So I'm going to share my screen if that's okay.
Sure.
All right.
Is he able to share his screen?
There we go. Okay. This worked out well. Can you guys see this okay? Do I need to enlarge it?
Nope, that's perfect. I got
Okay.
it. Perfect.
All right. So our team thought it was important. We just had a conversation on COVID. I think this is important to give you guys an update on what COVID did for Young Legends last year, and some of the things that we're proud of. Our team really wanted to demonstrate. So when the pandemic really started, we were ramping up for our own season, and we were ramping up for the rink development big time. We had met with the Bruins Foundation. We were in contact with Sherry Zizik and New Balance. So we were really excited with where this was projecting. And the next thing you know, the world is sort of coming to a halt. But our team decided that we wanted to be the light in the time of darkness and give people resources that they could use. And sort of, there was a lot of fear mongering going on a year ago. And like I said, we wanted to have our players, we wanted to keep things going as much as possible. So the first thing we did is we launched our virtual workouts, which was me and my stepsons and sometimes my wife doing a virtual workout. And we had players that would join us through Facebook Live. We still keep those up there. We had a pretty good turnout. Kids came and worked out with it. We went from about late March all the way up to June with those workouts. We've always put out newsletters, but we continue to put out information for our players and parents. Some things have to do with like mental toughness training, skill development pieces, things that we find very important. So we continue to do that either on a monthly or sometimes a quarterly basis. We even did a podcast, which was a lot of fun for me personally. I got to talk to some people like Jay Pratt, Paul Russo, who we all know and love, and other people from the ball hockey world. And what we were trying to do was to get, how do you handle adversity? How do people become successful in times of adversity? And so the podcast really, was trying to get that information, again, not only to our players, but anybody who wants to watch these. I'm going to skip our season for just a second. We opened up a brand new program in the fall. And again, as many people are aware, COVID, kids are sitting, they're less active. There's, that's Steve's favorite thing. There's all kinds of video games going on right now during the pandemic. So what we want to do is we wanted to introduce our skill development program, which focused on not only hockey skills, but also athletic ability. So we work plyometrics, strength training, and our kids work their tails off over the course. We had about 20 to 25 kids come through that program. And then what we decided to do in December is give their time back and really allow them to sort of just use the skills that they've been learning over the course of the fall. And we played pickup hockey up at Stage 4 for the 4 Sundays in December. And we had anywhere from 10 to 13 kids come each week. I got a chance to play as well. So we really try to keep active. Our season was sort of a bare bones season. We were first impacted by Governor Baker's plan where hockey was put into a high risk category. So one of our directors, Kyle Edmonds, coined this term, bubble hockey. So what we did is to get our season in, we played socially distanced hockey. So if you remember the old table hockey games with the metal rods, our kids literally stayed in sections that they could not cross over. Was it true street hockey? No, but at least we got to play. Kids got some socialization, and we crowned a champion, which was last year was the Bruins, which was actually a very powerhouse team. So that was sort of, 2020 in a nutshell. And, we're very proud of what we were able to accomplish. And again, our goal is to continue that into this year where we're getting more kids active. One of the questions that we're always curious is what's childhood obesity look like right now? And how can we help that sort of issue? But anyway, on to the rink and talk a little bit about what we've been doing. We did meet with the Bruins Foundation a year ago. They were really interested in the project. They were really interested in the rink because they don't have a lot of, a space up here in the North Shore. So they were interested in our project. So we officially asked them for a specific grant. And we also asked the New Balance Foundation for a grant. Those are our home run hitters, if you will, for what we're looking to do. We are going to join the Chamber of Commerce. We had a great meeting with them recently talking about local businesses and how not only can local businesses help the support of the rink, but also how we can give back to those businesses in ways. So I'm going to come back to that in a second. So currently, where are we today as far as money? Well, we had the CPA grant. I was recently informed that we had an extension due to COVID, but we got a nice donation from Bank Gloucester. The GFAA had pledged $10,000. And then as our own organization, from our own fundraising projects to player tuitions, anything that we do, we're just putting it right into this rink project. So we're hopeful that this year we're going to get the money we need to actually get this rink built. We have a couple other campaigns that we're working on right now. We're really going to be looking to talk to local businesses, banks such as Institution for Savings, places like that, where we're really sort of trying to just engage conversations on what they might be looking for, as well as how we can help down the road. But again, I'm going to kind of come back to that in a second. It's been a little while since we talked to you guys. So the world of ball hockey has gone into kind of a really big direction. And we've sort of jumped in on that as well. So we have partnered with USA Ball Hockey and the US Deck Federation. Both groups know about our program in Gloucester. They know about the rink project. We've actually made a deal that once the rink is built, that we'll be able to have a national tournament that would be sanctioned by USA Ball Hockey. And so we're excited for this, and we need those people to help us with our program development as well. Just sort of a little sidebar that we're going into this year is we were invited to Leominster for the U.S. Nationals. So for the first time, we're taking a team of Gloucester and Rockport kids to Leominster to compete in the U.S. Nationals as long as COVID allows it. So we're really excited about that, and we even have an adult team of about 20-something-year-olds getting ready to gear up either for a tournament in April or potentially in Leominster as well, but that will take place in September. So we've got a lot more people getting involved in the game, and that's why the rink becomes more important. I think I do want to emphasize for everybody, though, is that even though Young Legends wants to, like I mentioned, create grassroots programs, make sure that we're getting as many kids into the world of street hockey, getting them active, is that this rink is really for the community. And, I'll say his name is a gentleman named Wesley Prevost. We grew up playing ice hockey together. He has 4 boys. I would love to see someday just driving up there, seeing him with his 4 kids out there playing on the rink. So even though Young Legends has plans to utilize this rink in many different ways, it's important that everybody understands that, if you want to go up there and play, it's there for you. And we hope you take advantage of it, more important. So where are we with the rink? So 3 years ago, it's crazy. 2018, we came and asked you guys for help to see how we would actually get this started. We've done a tremendous amount of workout. I'm really proud of our team. We've stuck together through a lot of the major conversations. So a couple of big decisions were made recently. Right here, this picture is what we call the MS3. They are out of Leominster. We have partnered with them to get their tile, and their agreement and our agreement says that the Gloucester rink will actually be one of the showcase rinks. So we will always have some really nice tile going on there. So if a tile breaks, they'll be sure to fix it, because like I said, this rink is going to be sort of in their magazines and stuff like that. So we're really excited about the partnership with Leominster. They're the best in the industry. We took a lot of time to, my brother and I, my father, we took trips to a lot of these different rinks. and it was the best tile that we could come across. I did want to say that we did break this project down based on money into 2 phases. There's going to be some site work up there at Stage Fort, putting down either a cement pad or an asphalt pad. But then so that's sort of the phase 1, putting the boards in, the tile, and a nice walkway that goes all the way around the rink. And then later on, we'd like to get the lights, scoreboard, and some bleachers for everybody. But I guess this is more in stages as we get more money. We did decide, this is just another picture of of MS3. This is their tile. We also partnered with Athletica, who is basically the preferred supplier of the NHL with the boards. The boards and the tile, we took a tremendous amount of information and detail in designing this rink. And we're going to ask a lot of these boards. They're going to have to be out in the salt air. They're going to have to be exposed to street hockey balls, potentially inline pucks. Sean Nolan knows lacrosse balls, maybe soccer balls, whoever else is using it. So these boards are going to be, like I said, top of the line. And so and we're going to be expecting a lot of them as well. So that's sort of what the benches will look like. And here's just another picture on the outside of the boards. It will be fenced in as well, all the way around. But this just gives you guys some ideas on what it will look like as far as the outside. So we did work with John Judd. He created these pictures. You guys are welcome to. I'm not going to go over them in incredible detail tonight. But like I said, there's not a lot of stones unturned at this point. We've looked at a lot of different rinks and a lot of different avenues. So to sort of finish up tonight, I did create one other document for you guys that talks about our partnerships a little bit. We reached out to both Fitchburg Street Hockey and Leominster. They've been around since the 70s. But I want to say this is why it's important that we want to meet with local businesses. The Fitchburg Raider Cup is for youth players, 7 to 16 years old. They started back in 2014. I know Tom McMaster, he's the president, and he's talked about maybe doing something with our organization as well. But basically, the sum of all of this is that Fitchburg has grown to have outside teams that come from New York, Pittsburgh. There's teams growing in Washington, Florida, even down in Texas, that are coming up to play in Fitchburg. And so what they're doing is the mayor has started to recognize that, during the month of June, the Great Wolf Lodge that is out there is totally booked out. So why is this important? Is if Young Legends was to host either a national or some sort of youth or adult tournament, I'm going to quote Jill Cahill and Senator Tarr here. They said, do it on the shoulder seasons, not during the summer, where we could potentially get more people into the city. And that's why businesses we would need help with. And one of the things that we're working with the chamber on is potentially putting together a profile of, where can our participants stay, what hotels, what restaurants, all of those things that can help. And just sort of sum up with all of this information on, these partnerships. What really makes them important is when they have your back, they're more likely to advertise your tournaments and get more people into the city. So that's just sort of a revenue stream that could potentially help a lot of local businesses. And that's where, we are looking to partner with those organizations as well and those businesses. But again, I think you guys all have that. But again, our goal is to someday have tournaments that Gloucester can host. And like I said, potentially it could be a national or a regional event. So the last thing that I have for everybody is, if I can pull it up, you'll have to forgive me. My brother's the expert on this. It's his design. He's done all the work on this. I'm just sort of the puppet master here, but I'm going to give you a brief tour in this 3-dimensional model of what the rink will most likely look like. This is not drawn 100% to scale. And forgive me, like I said, I don't know how to navigate this, but this is sort of where we are right now, is where the dog park is, and it's going to zoom in a moment, and just give you down Huff Ave, and then it's going to come back. Again, the back is not going to look as steep as you guys can see from this angle. We're going to taper it off a little bit, and there will be a retaining wall. But again, this is just sort of the rink in a nutshell. That's a little fast. I'm going to stop it here. and just put you guys in the rink. By the way, this is the first time we've released this publicly. The mayor has gotten a chance to see this and some others. But this will be sort of, if I can get him in there, sorry. There we go. This will be sort of where all of you will get a chance to walk in and play. And again, just to summarize, you know, as much as our organization wants to utilize this to the fullest, we want to make sure that you know, if someone wants to do boot camps in there, if people want to do, you know, lacrosse, some roller derby, which I'd love to see, this rink has the capability. So that's all I have. I thank you guys for everything. I appreciate all the support. And I will turn it over to you for any questions you may have.
All right, Carl, awesome. Hold on a second. Do we have any councilor questions? Councilor Nolan.
More of a comment. I've been a fan of this since they brought it up to us. Looking into the street hockey, the end of that, Councilor Harrod had mentioned something about Leominster. So I did go see Leominster's operation. What this is the ability to do with talking to Carl is not just the run-in or street hockey, but the inline blade or roller skating, or an opportunity for people to use the facility or rent the facility to have a party. I do think that it's an excellent situation for the basketball court, which is not really used as much as it could be. And as an example, for them to use off-date situations in the fall or early spring to have leagues come up and take care of the venue and book hotel rooms and help businesses. I really do like this idea a lot. And Carl, thank you for everything you've done.
Sure.
Thank you, Sean. Councilor Holmgren.
Piggybacking on what Councilor Nolan said, Carl, you should be proud. You have done such an amazing thing here. I am so impressed and grateful. Thank you for your generosity in sharing this idea with the community, with all of the work you've done with community partnerships, and especially supporting the children here with an unconventional and fun, moving activity. This is so awesome. Thank you.
Thank you.
Thank you, Jen. Any other councilor questions? All right, so I'm going to jump in. All right, Carl, that's awesome.
Thanks, Steve.
So I got friends of mine in Southern Mass, and they call it deck hockey. What are we calling it? Is it street hockey? Is it deck hockey? What's the terminology we use?
That's a hard question.
Right?
It's a hard question depending on who you talk to, but you know, Leominster was really the beginning of all of this, and they call it deck. They turn that coin deck. You know, I grew up, you know, playing the streets of Gloucester. I've always considered it street hockey. So, but I don't have an exact answer for you, Steve, because I hear people calling it ball hockey now, and actually it's based on rules. It's based on rules now. They've changed it on the rules that you play. It's a really good question, but yeah. Who knows? Maybe you know, I'm a big fan of Leominster. You know, I visited it 3 times now. They treat us like gold when we go there. Their game plan is to come, you know, to our rink as well and potentially have a regional tournament with us. So, but I'm going to leave it up to whatever you want to call it, ball, street, deck. And as Sean mentioned, is we're going to be getting tile that, you know, obviously you guys will be able to rollerblade on. And that's in our pipeline as well. I mean, the thing about roller hockey is that it's a different game. You know, now you're adding equipment in there, whereas you're sometimes limited on who has blades and not, but it's still a great sport. I love it. But yeah, so I just sort of stick with street for now.
I agree.
Sorry for a lack of answer. Yeah.
I'm old school. Always be street hockey.
You got it.
So you mentioned the tile several times. So is the tile a composite or is it an actual glass tile? I mean, what are we talking about?
It's a plastic composite sort of material that you know, it's why we went with tile was for 2 reasons. One is the way the ball or puck moves on it is pretty top notch. It's almost like I'm not going to say it's like ice because it's not, but It's top notch, but also what we were really trying to do is reduce the tension on your legs as you're running. When we host our adult tournament at the O'Malley rink, you're going to feel it because you're running on concrete. So we felt that tile was the most suitable. There's a little bit more give to this tile. We first were privy to the Metaflex tile, which poor Sean's seen about 5 times too. But we ended up going with the MS3 tile because it was softer and softer on your joints. So yeah, but it's a plastic composite to answer your
Good.
question.
Yeah, it'd be nice to see these kids up there. I'm lucky. I live in a little cul-de-sac where we have very, very little traffic, and we have the kids 2 doors up. They have a rail net pipe, so it's nice to see these little kids out there, and they're out there with the street hockey ball. And I hate to admit it, but I still got it. Every once in a while, I go over, I grab a stick, I do the Ray Borg thing. I hit. They've got a dangling hoops.
Awesome.
And I can hit 3 out of 4, no problem.
Yeah.
And it's good to get some of these young kids in there. I've known Wesley my whole life. It's good to get people like that. He's been part of the boxing club, Gloucester Boxing, so he's got his hands in some of this youth. And it's unfortunate that we have lost our Pee Wee program with our football. So this would be nice to try to start something up like this in town. You see on social media, people are asking where their children can play baseball or Babe Ruth and stuff like that. So, be a little hidden gem for Gloucester to be able to have this and promote youth sports in Gloucester, because I know we've pumped out quite a few impressive hockey players out of here.
Sure.
To have a year-round program where we skate in the winter, not only at the rink, but pond hockey, which I still play also, but on this, street hockey deck would be awesome. So, you've done a great job. I appreciate everything you've done. I know it's a ton of work. I'd love to give you a hand. So definitely reach out. I know we've connected a couple of times, but
yeah,
seeing what it's going to be, don't hesitate to reach out to any one of us, and we'll give you as much help as we can.
Yeah, I appreciate the time, everybody. Thank you. And
awesome.
We'll
Thank you
get
for
going.
being patient last week and
Sure.
jumping back on this week. We appreciate
My
everything
pleasure.
you do.
Thank you.
All right. Thank you, Carl. All right. So that ends our presentation. So Madam Clerk, can we have the next order of business, please?
Wasn't a presentation meeting.
The next order of business is confirmation of new appointments.
All right, Councilor Nolan. Oop, you there, Sean? Sean, can you hear me?
Sorry about that. We have Dave Sargent for the Conservation Commission, who will fulfill an unexpired term to expire 2/14/22.
You want to move it?
Second.
All right. You want to move it, Sean? I haven't moved it.
Oh, yeah, no, I definitely, no, I want to move. I'm sorry, paperwork.
I
Yes.
get you. All right, so it's been moved by Councilor Nolan, seconded by Councilor O'Hara. Any discussion? All right, I'm sure we all know Dave, and we have great things to say about him, so it's a pleasure to have Dave fulfilling an unexpired term. With no other discussion, I will call for the roll call. Councilor Memhard,
Thank you for your service, Dave. Yes.
Councilor Nolan,
Yes.
Councilor O'Hara,
Yes.
Councilor Pett,
Thank you for volunteering again, and thank you, yes.
thank you. Councilor Cox,
Yes.
Councilor Gilman,
Yes.
Councilor Holmgren,
Yes.
Councilor LeBlanc, yes, and Councilor McCarthy.
Yes.
All right, motion passes on a roll call vote of 9 in favor, 0 opposed. Councilor Nolan, next one, please.
Yeah, up next, you have to forgive me, my other screen is down. The Ordinance and Administration Commission had voted to put William C.S. Remsen as an alternate member for the Historic District Commission, and I so move.
Second.
All right, been moved by Councilor Nolan, seconded by Councilor O'Hara. Any other discussion? Counselor Gilman?
We should amend that to the term to be expired is February 14th, 2022.
I'm sorry, I thought we had said that. Sorry.
Okay, so on the amendment, no discussion, obviously. So we'll have to do a roll call on the, we'll have to do a roll call on the amendment. Counselor Memhard,
Yes.
Counselor Nolan,
Yes.
Counselor O'Hara,
Yes.
Counselor Pat. Barry,
Yes.
Counselor Cox,
Yes.
Counselor Holmgren,
Yes.
Counselor LeBlanc, and yes, and
Yes.
Counselor McCarthy.
Yes.
All
You
right.
forgot
and-
me.
Oh,
Gilman,
oh, I'm
Yes.
sorry, Counselor Gilman.
Thank you.
Yes.
Yes.
Thank you. Amendment passes on a roll call vote, 9 in favor, 0 opposed. All right, back to the main motion. Any other discussion, Counselor Nolan?
No.
Nope, seeing none, I will call for the roll. Counselor Memhard,
Yes.
Counselor Nolan,
Yes.
Counselor O'Hara,
Yes.
Counselor Pat,
Yes.
Counselor Cox,
Yes.
Counselor Gilman,
Yes.
Counselor Holmgren,
yes.
Counselor LeBlanc, yes, and Counselor McCarthy.
Yes.
Motion passes on a roll call vote, 9 in favor, 0 opposed. Up next, Counselor Nolan.
The Ordinance Administration Committee voted in favor for Jamie Marshall for the Stage 4 Park Advisory Committee, term to expire 2/14/24, and I so move.
Second.
Been moved by Counselor Nolan, seconded by Counselor O'Hara. Any other discussion? All right, seeing none, I will call for the roll call. Counselor Memhard,
Thank you, Jamie. Yes.
Counselor Nolan,
Yes.
Counselor O'Hara,
Yes.
Counselor Pat,
Yes.
Counselor Cox,
Yes.
Counselor Gilman,
Yes.
Counselor Holmgren,
Yes.
Counselor LeBlanc, yes, and Counselor McCarthy.
Yes.
Motion passes on a roll call vote, 9 in favor, 0 opposed. All right, Counselor Nolan, last but not least.
We have two on this, both known to the city. The Ordinance and Administration Committee has voted to confirm in the Traffic Commission Lieutenant Michael Williams and Drew White to the Traffic Commission, obviously, term to expire 2/14/24.
Second.
All right, it's been moved and seconded for Lieutenant Michael Williams. It's been moved by Counselor Nolan, seconded by Counselor O'Hara. We're going to take these up individually. Any discussion? Seeing none?
Counselor Blank.
Yes, Counselor O'Hara.
Yes, I need to recuse myself from this vote, please.
Okay. Is there a
Thank you.
reason? Do you have a reason? Usually we have a reason.
Yes.
And we said-
Yes.
What was that?
On Drew White, he has a reason.
All right, well, right now we're on Lieutenant Michael Williams.
No, I'm good.
Okay, so you're gonna vote on this one?
Yes.
Okay, Counselor Memhard,
Yes.
Counselor Nolan,
Yes.
Counselor O'Hara,
Yes.
Counselor Pat,
Yes.
Counselor Cox,
Yes.
Counselor Gilman,
Yes.
Counselor Holmgren,
Yes.
Counselor LeBlanc, yes, Counselor McCarthy.
Yes.
All right, and up next we have Drew White. So go ahead, Counselor O'Hara, you're gonna recuse yourself from this one?
Yes.
Okay. All right, so Counselor Memhard,
Yes.
Counselor Nolan,
Yes, thank you, Drew.
Counselor O'Hara is abstaining. Counselor Pat,
Yes.
Counselor Cox,
Yes.
Counselor Gilman,
Yes.
Counselor Holmgren,
Yes.
Counselor LeBlanc, yes, and Counselor Memhard. Counselor McCarthy, I'm sorry.
Yes.
All right, thank you. Motion passes on a roll call vote of 8 in favor, 1 abstained. All right. Thank you, Counselor Nolan. We appreciate that. Madam Clerk, can we have the next order of business, please?
The next order of business is the consent agenda.
All right, do we have any council that would like to remove any matters from the consent agenda? Councilor Cox.
Hello. I just have two matters to pull. Item, where are my notes? Item number 10 under the Budget and Finance report. And also Lisa Nagello for a reappointment to the Magnolia Pier.
Right, is there any council that wish to remove anything from the consent agenda? Councilor Gilman.
Thank you, Counselor. I'd like to remove the P and D March 3rd, 2021 Standing Committee meeting minutes.
All right, anybody else? All right, seeing none, Councilor Cox.
The first item that I have is number 10 under Budget and Finance. It was inadvertently put on the agenda that is scheduled for a public hearing on March 23rd.
Okay, and item number 2.
Lisa Nagello, I just would appreciate it if she could come before O&A for her reappointment. She wasn't able to, and it got moved forward.
Okay, so you want to pull her and put her back to O&A. You want to put that in a motion so we can vote it to go back to to O&A?
I move that Lisa Nagello is put back to O&A for a reappointment for a presentation.
Right,
Second.
It's been moved by
Be
Councilor
best.
Cox, seconded by Councilor Hara. So we'll tidy this up. So the first one was just information. This one is.
Yeah.
Okay. All right, so we're gonna vote on this one first. Councilor Memard,
Yes.
Councilor Nolan,
Yes.
Councilor O'Hara,
Yes.
Councilor Pat,
Yes.
Councilor Cox.
Yeah.
Yes?
Yes.
Okay, you broke up on me for a second. Councilor Gilman,
Yes.
Councilor Holmgren,
Yes.
Councilor LeBlanc, yes. Councilor McCarthy.
Yes.
Motion passes to send Lisa McGallo back to O&A for reappointment. And Councilor Gilman.
Thank you, Counselor. In the motion on the inclusionary housing requirements, there was a tiny Scribner error where by mistake in the last line, we said and instead of in, and it sounded awkward. So I went back and listened to the Zoom meeting and I was correct. So it was made correctly in the meeting, and I just wanted to correct it. So in the last line of the inclusionary housing requirements motion, I moved to amend by deleting the word and adding the word in. And I so move.
Second.
It's been moved by Councilor Gilman, seconded by Councilor Holmgren. All right, any other discussion, Councilor? Seeing none.
I'll just read the line if that's okay, Counselor, in my discussion. It should say as follows: these revisions are accompanied by an expansion of defined terms to make it clear what the ordinances require and what an applicant needs to consider in project development.
Thank you.
Thank you.
All right, it's been moved and seconded. Any other discussion? Seeing none, call for the roll call. Council Memhard.
Yes.
Well, there you go. Councilor Nolan,
Yes.
Councilor O'Hara,
Yes.
Councilor Pat,
Yes.
Councilor Cox,
Yes.
Councilor Gilman,
Yes.
Yes.
Councilor Holmgren,
Yes.
Councilor LeBlanc, yes, and Councilor McCarthy.
Yes.
All right, motion passes on a roll call vote, 9 in favor, 0 opposed. All right, so now we have to accept the consent agenda as amended. Okay?
So
one
moved.
more-
Second.
Second.
Moved and seconded by Councilor Cox and seconded by Councilor Memard. Any other discussion? Seeing none, Councilor Memard,
Yes.
Councilor Nolan,
Yes.
Councilor O'Hara,
Yes.
Councilor Pat,
Yes.
Counselor Cox,
Yes, and I'd like to point out that Budget and Finance is doing all the heavy lifting again on this consent agenda.
atta girl. Counselor Gilman,
Yes.
Counselor Holmgren,
Yes.
Counselor LeBlanc, yes, and Counselor McCarthy.
Yes.
All right, motion passes to accept the consent agenda as amended, passes on a roll call vote of 9 in favor, 0 opposed. Madam Clerk, can we have the next order of business, please?
The next order of business is the Standing Committee report of the Budget and Finance meeting of March 4th.
Thank you. Counselor Cox?
Counselor?
Counselor Gilman, yes.
Did we do the unanimous consent agenda vote?
We don't have one. We have a unanimous consent agenda for Budget and Finance. Okay, Counselor
Okay,
Cox?
I'm sorry. I got it out of order.
Counselor
Excuse me.
Cox?
My turn?
Yep.
All right, I would like to present the Budget and Finance unanimous consent agenda. If anybody would like to pull anything off of that, please do so.
I think your
Val?
cat does.
What?
Somebody's
What?
cat wants to pull.
I'm
Oh,
good.
that's my cat.
I didn't mean to interrupt. I thought that was just an overall vote that you weren't presenting. So, no, I have nothing to remove. Thank you.
Okay. I would like to bring to everybody's attention that I am currently working as the Budget and Finance Chair to put procedures in writing for our overall procedures. And part of that is to include information on CPA. They are required only to hold one hearing a year, and we do that typically with the annual presentation like what we're doing tonight. And that covers the legal requirement for all CPA presentations. I am also working with community development and the administration on just fine tuning the details on that and some other things. But I think it's important that we have all this stuff in writing in our procedures for future councils. So again, I moved the consent agenda because I can't remember if we did that already.
Second.
All right,
Thank you.
We did. It's been moved and seconded. Thank you. Any other discussion, Counselor Cox? No.
No,
All right. So I will call for the roll call for the consent agenda for Budget and Finance. Counselor Memhard,
Yes.
Counselor Nolan,
Yes.
Counselor O'Hara,
Yeah, yes.
Counselor Pat,
Yes.
Counselor Cox,
yes,
Counselor Gilman,
Yes.
Counselor Holmgren,
Yes.
Counselor LeBlanc, yes, and Counselor McCarthy.
Yes.
Motion to accept the consented Budget and Finance consent agenda passes on a roll call vote of 9 in favor, 0 opposed. All right, Madam Clerk, can we have the next order of business, please?
The next order of business is the Standing Committee report of the Ordinance and Administration meeting of March 1st.
All right, Counselor Nolan.
Counselor LeBlanc, I'm still having a hard time pulling up the actual motions. I'm still on the template and I can't find it. And this is a detailed motion to read. If someone could read it for me, that'd be awesome. And if you could waive the reading of it, that'd be great too. But I could read it, but I don't have the motion in front of me.
All
I'm
right,
sorry.
So it is quite lengthy of a motion. So with that being said, we'll entertain a motion to waive the reading of the entire motion.
Second.
Second.
And we're moved and seconded. Any other discussion? So I just want to let everybody know that is interested in it. It is on the website, it is in our packet, and it is on the city council. It will be in the minutes. So if you want to reference this, and it will be out there, and the clerk will be able to provide it if anybody wants it from the clerk's office also. All right, so motion's been made to waive the reading of the ordinance administration. Councilor Memhard,
Yes.
and this is just to waive the reading of the motion. Councilor Nolan,
Yes.
Councilor O'Hara,
Yes.
Councilor Pat,
Yes.
Counselor Cox,
Yes.
Counselor Gilman,
Yes.
Counselor Holmgren,
Yes.
Counselor LeBlanc, yes, and Counselor McCarthy.
Yes.
All right, motion. So, so before we vote on the actual motion, Sean, you want to just brief us a little bit on the meat and potatoes part of this motion, so that way the people in the audience can hear it, so it doesn't look like we're trying to sneak something through.
I definitely can. I don't have the motion in front of me. I'm still trying to search it through one means.
No, that's fine. If you go back to the meeting, you can just explain briefly what the basic, like I said,
What this comes down to is it's a home rule petition basically, and it's through the police chief. And it's to bring back some retired officers that are, retired, but doing details, was still to give them the Chapter 91 abilities, the same powers of arrest or enforcement while they're there. It doesn't include or affect any of our obligations to the retirement fund or the funds towards that. There's a maximum age of 70. It's more of a housekeeping situation that we're finding across the state, where guidelines are where retired officers are allowed to do details, but they're not allowed to have the full extent of law of the police department behind them as enforcement of the law. So it's not a real big thing. It's a real detailed situation. There's a lot of laws, with Section 99A, Chapter 41, 150E of the general laws, 111F. It doesn't affect anything too much more than to give a little bit more beef behind the officers doing a detail or being pulled back in from reserve duty to full-time due to circumstances of a suspension or fire in to fill details or to fill shifts.
so basically it's so if a retired police officer is called into duty, they will have the powers of a police officer that is enlisted as of today. They'll have the same power if they're on shift, correct?
That is correct. It's just to open up different things. I see Council Holgram does her hand up too.
Council Holmgren?
Thank you. I do want to add that Councilor O'Hara read the entire thing at the O&A meeting in very detailed, and I thank him for that.
Thank you, John. Thank you, Council O'Hara. Yeah, I just wanted to give a brief overview of what we're voting. So I know we try to be, transparency, and I don't want the public to perceive that we're just sneaking something through without having any discussion on this. Councilor Pat?
Yes, thank you, Mr. President. Since we're not having the detailed reading, and I understand and agree that we don't need to, I was just wondering if maybe we could ask Council McCarthy to weigh in and give, his knowledge and experience here as to what this does for the community. John, would you be able to weigh in for us?
Yeah, John, if you have-
That's something you want, Council?
Yeah, if you want to touch briefly on it, that's fine. We've already waived the motion, but if you want to give us a brief overview in your eyes, being a former police chief and 800 years on the police force, we'd appreciate it.
Basically, it's housekeeping. It's we've always had, because of contracts, officers that have worked after retirement. This enables them to be fully trained. They have to keep up with all the training. It's takes a lot of the liability for having these guys out there because they are fully trained. They're trained in all aspects of what every police officer has to train in. And they do that on their own so that they can make extra money. So it's beneficial to them, but it's also beneficial to the department to have full-fledged officers out there that can be used. And they're only used after the regular officers have turned down this work, and it supplements the police department. It's something that we've been trying to get done for a long time, and kudos to Chief Conley for getting it through.
Thank you, John. All right, so we've got the reading wave, but we haven't had the motion. So, John, do you want to read the actual motion? Do you have that in front of you, or do you want me to read it?
Counselor,
I do have it, but
Councilor-
Councilor Cox's hand up.
Oh, Council Cox.
is Chief Conley not present to speak to this?
Let's see. I don't see him.
Okay,
Hold on one
I just
second.
wanted to give him the opportunity,
Yeah,
since
he
he
is-
is the police chief,
Yep.
to speak on the order. It was his request.
I don't see him in attendance. Okay.
Thank you.
Sean, do you want to read the actual motion part?
Yep, the Ordinance Administration Committee voted by roll call, 3 in favor, 0 opposed, to recommend the city council request of the state legislator file a home rule petition, and based on said petition in general court, enact a special act substantially as follows. And then the rest has been waived. I can go on if you'd like.
No, you want to move it?
Second.
All right, it's been moved and seconded. All right, any other discussion? It seems like we already had our discussion part of things, so we'll go right over to the roll call. Councilor Memhard,
Yes.
Councilor Nolan,
Yes.
Councilor O'Hara,
Yes.
Councilor Pett,
Yes.
Councilor Cox,
Yes,
Councilor Gilman,
Yes,
Councilor Holmgren,
Yes,
Councilor LeBlanc, yes, and Councilor McCarthy.
Yes.
Motion passes on a roll call vote of 9 in favor, 0 opposed. Madam Clerk, can we have the next order of business, please?
Next order of business is the standing in committee report of the Planning and Development meeting of March 3rd.
Councilor Gilman?
no items to be brought forward. Thank
Thank
you.
you, Council. Madam Clerk, next order of business, please.
Is the first public hearing 2021-003 to amend the Gloucester zoning ordinance, section 5.11, inclusionary housing requirement.
All right. Before we start this public hearing, I don't know who's jumped on since then, but we are not having 99 Essex Avenue move forward this evening. So if you're here for 99 Essex Avenue, they are going to withdraw this without prejudice, just so everybody knows. There will not be a vote. It'll be voted on to withdraw 99 Essex Avenue. Will be off the table when we get to it during the public hearing part. All right, so I will open the public hearing and ask if there is anybody that would like to speak in favor. And we see our planning director, Greg Cadamatori. How are you?
Good evening, councilors. Greg Cadamatori, Planning Director. If I could, I'm going to share my screen.
Okay.
Can everybody see that okay?
Yep.
Okay, so this presentation, I'll try to be brief. I know you've had a lot of business this evening, but I appreciate that I'm starting at 7:38 and not 8:38 if we were conducting business a year ago. This presentation should look pretty familiar as this is a subset of what I presented at the initiation of the amendment back on January 26th. It's also been reshaped for the planning board public hearing as well as the P&D hearing last week. And so I'll just kind of quickly walk through it. Again, this is the proposal to amend section 511, the inclusionary housing requirements. We have a current ordinance. We would be replacing it with this proposal in its entirety as it's been rewritten and really designed to address the affordability needs in Gloucester. And so one of the first things, I may have presented some of this information at the initiation, but I'll reiterate it now. I think, again, one of the things that we've learned through the development of the housing production plan, and also as people are looking in the market every day, it's a greater and greater a challenge to find something affordable for a lot of people, not only in Gloucester, in the North Shore region, but also in Massachusetts. I believe we are currently one of the states with the highest average home sale price. And it doesn't seem like there's an end in sight, which is good for people that are investing in property and selling property. It's a challenge for people that are trying to get into the market and find housing that suits their needs. So one of the things that I wanted to be clear on and remind everyone of what we mean when we use the term affordability. And in the context of the ordinance that's proposed and within the state, there are very specific definitions about what affordability is and means. Gloucester is included in what's called a statistical area or a metropolitan statistical area that's developed by Housing and Urban Development. So it's a federal creation. And we are in one that includes more than 100 communities around the Boston metro area. And therefore, in the eyes of the state, when affordable units are created, they are all based around the median income for that region, which currently is $119,000. And if you were to look at the current income levels in Gloucester, our median income is around $65,000. So there's a huge disparity between the main statistics that is used to calculate affordability. And therefore, that's why there are proposals to, in some ways, redefine affordability in a fairly novel way in this proposed ordinance. So the state definition of affordability and the HUD definition of affordability is sales prices or rental incomes that are available to households making 80% of the area median income. So again, that's equating back to that $119,000. So this table on the slide shows the income limits, and they also get adjusted for household size. So again, this that for a one-person household, the 80% AMI maximum income would be around $67,000. And then you can see on that the bottom, if you can see my cursor, the bottom row in this first table, again, it goes up depending upon the number of folks that are in a household. So a typical family of 4 could have a maximum income of $96,250. When this gets translated to rentals, so there are maximum rents that can be charged if they are deemed an affordable unit that's either created by a 40B process or potentially an inclusionary housing ordinance. So these are the maximum rents. Again, they're also adjusted on the number of bedrooms that they might have in them that would translate from the table above. So a one-person household would have a maximum income of 67, and they would expect the maximum housing cost would be around $1,715, and so on as you go along this table. So this fair market or affordable rents is just the translation of the 80% AMI. And I'm going to go further talking a little bit about 60%, because that's one of the targets of the inclusionary housing ordinance, to provide a deeper affordability or to reach those households that only make 60% of the area median income. Councilor Gilman at the P&D level suggested that perhaps I take a pause after each slide if anybody wanted to ask questions as I go along, or I can just continue on however folks would like to proceed.
Any council questions? All right, seeing none. Go ahead, Greg.
So you're all paying such great attention. You've seen this so many times that there's no questions. I like that. So I will move on. So I also wanted to provide a snapshot. Again, this is around the housing goals that have been defined in the housing production plan. Part of it is not only providing affordable housing that meets local need, but one of the side effects, if that occurs, is to start to get closer to meeting the state mandate of 10% of the housing stock being affordable. These numbers are hot off the press. We do submit either local action units that are created by inclusionary ordinances, or 40B projects also submit to the state, as well as any affordable unit that's created by any of our CDBG programs. And so as of March 4th, we have 1,038 affordable housing units in Gloucester. So we are currently at 7.82%. So that's a little bit of an uptick from even the presentation that I gave last week. They are at a variety of affordability levels. There are some that have deeper subsidies associated with them, depending upon funding sources that were used in projects. They also have differing durations. So that's one of the things that we also have to be keenly aware of with our subsidized housing inventory, that they are not all perpetually affordable. Some run on 15-year timeframes, some run on 30-year timeframes, and then there are those that potentially are in perpetuity. So part of the discussion also was to provide some of the real world examples that we now are seeing coming online more recently. So the number of affordable units permitted or under construction, the Halyard departments, those 30 units that are at 80% AMI were really largely responsible for that uptick to 7.82% because they were just added to the inventory. The Harbor Village units, the 30 units are going to be available at 60, 50, and 30% AMI. There's a variety of 1, 2, and 3 bedrooms in that project. And they will likely be added to the inventory when they are occupied. It's a slightly different process of how they enter the subsidized housing inventory than when a local unit, it's on the city to provide the documentation to the Department of Housing and Community Development. In a 40B process, it's the applicant that files and establishes them with the housing inventory with the state. And then lastly, most recently, the permitting of 71 Middle Street, the 44 senior affordable housing units, which will be offered at 60 and 30% AMI. So I'll pause there. And if I'm talking too fast, just let me know.
I do have one question. Greg, hello. Hi, thank you.
Hi. Sure.
So just for clarity, for the benefit of the public, I'm so thrilled to see that our housing stock is up to 7.82% now. But what is our goal?
So the most clearly articulated goal in the housing production plan is to meet the local need. It's a difficult, thing. We constantly hear stories, anecdotal stories of people that, feel that they are priced out of the market, that they can't find units, any type of housing, whether it's single family home, 2-family home, or a condominium apartment that they can afford. So the state's goal is 10%. And if that is achieved, that changes the kind of permitting landscape in that the community would receive what's called safe harbor and have a little bit more control over the potential for 40B projects to be filed. We clearly have examples of projects where we've had cooperation and really a great partner in a 40B applicant to provide what the community has defined that it needs, and projects that are suited for the locations that they've been proposed. So it does give you a little bit more control over that. There are certainly countless examples in Massachusetts where there have been projects that perhaps have been over capacity for an area or really out of character and capacity for an area. And that's what you're protected from if you reach that 10%. If we do reach that 10% and there's still a need, again, it's an arbitrary number. And so again, it's really about trying to provide for the local need.
Thank
I
you.
hope that answers the question.
Yes, thank you very much.
Hold on a second. Any other councilor questions at this point? Okay. Seeing
Okay.
none. Very good. Thank you.
So one of the other things I thought it was important was also to kind of just, by job category, identify, who needs affordable housing, who in the community are the people that, if these units are provided for, would be reaching. So I looked at data from the Bureau of Labor Statistics for Massachusetts. So these are all income levels that have been cataloged and averaged and or provided the median for jobs in Massachusetts. So again, that 80% AMI, which is reflective of coming from that $119,000 statistic for an individual at around $67,000. These are the types of job classifications that the median income of that group of individuals that are surgical assistants, interior designers, pilots of water vessels, a physical therapist assistant, or paralegal. So that's who would be eligible potentially for a unit that was created at that with that income cap. And then just for comparison, 60% AMI statistic for the same region is an individual making a maximum of $53,700. And there's some job categories. So again, it's just to kind of, without having an individual come to a public hearing and say, that's me, and put themselves on the spot and identify what their income is. These are all people that live and work in this community, perhaps commute to this community or commute elsewhere, but they're real people, they're real jobs, and this is the reality. And the challenge is, at that level, it's very difficult to qualify for much of anything that's on the market for the condominium or single family home market. So that's the target, and that's the need that's been identified with our statistics of having a median income in Gloucester of $65,000. So that's just the median. So that's half of those individuals are making less than that, and half are making more than that. So just to provide some context of who it is that is in need of affordable housing. And there's other job categories that I didn't include. I just had a subset. And I'll stop there for a second. Okay, seeing none. So then the real world examples of what that actually looks like as projects are being built. So this is part of the marketing materials for the Halyard Apartments at 4 Schoolhouse Road. Again, they have a mix of studio 1 and 2 bedroom. These are the number of units that'll be in the entire project. And again, at 80% AMI, those maximum income levels, it is adjusted for the number of bedrooms or the household size. And so that's the maximum income. And then these are the rents that are currently being marketed. Another real world example is Harbor Village at 206 Main Street. This is also from their website of marketing materials. And you can see how they actually record in some instances a minimum income to be sure that someone is going to be able to carry the cost of the rent for the unit that they would be occupying. Make sure they're not cost burden, which is a term that you've probably heard before. The goal is to have, I just got some feedback. The goal is to have folks not spending more than 30% of their income on housing cost. So that's why they also include in some instances a minimum income level. And then you can see a 1 bedroom is being offered at $1,440, a 2 bedroom at $1,728, and a 3 bedroom at just under $2,000. And so I'll pause there with some of the real world example and some of the background, and get into the actual mechanics of the changes to in the proposed ordinance. Everybody good? Okay. So the proposal, as you know, we've had an ordinance that's been on the books for quite some time that had a threshold of 8 units and required affordability of 15% of the units in a project to be provided at 80% AMI. Again, going back to that background that I just provided. So the proposal is to lower the threshold in all districts that have housing allowed or that create 6 or more units. So that's in multifamily, subdivision, cluster developments, open space residential developments. If they create 6 or more units, the inclusionary ordinance would be triggered. So that's the threshold. But there was a lot of discussion with the Housing Production Plan Working Group, as well as the Planning Board, to really try to make allowances for smaller projects, and also send a clear message in this ordinance that it is about inclusion, that the primary goal of the ordinance is to create affordable housing in developments, rather than having offsite or potentially just accepting in lieu payments, although there is an exception to that. So projects between 6 and 9 units would only have to provide 10% affordability at 80% AMI. Projects of 10 units or more would have to provide 15% affordability. And I'm just calling it out. That is parity with the existing ordinance. It's always been 15%. So there's no real change there. And at 80% AMI. There is a little bit of a difference in this ordinance after a lot of discussion about certain housing types that are actually excluded from this, which would include group homes, assisted living residences, as well as renovations that don't increase unit count. So if someone had a 6-unit project that was someone purchased it and decided to renovate it substantially, maybe add an addition but not increase the unit count, it would not apply to such a project. Again, on-site is required for all projects with 10 units or more. But the up to 9 units, the 6 to 9 units could make an in lieu payment, and that payment is tied to local median sales figures. And I can go that in a little bit more depth in a comparative table. And finally, again, to try to address that deeper affordability, and this will, remains to be seen if it's effective or not. But the idea is to provide an incentive for deeper affordability to provide units that will be available to households making 60% of the area median income, in that they would only have to provide 10%. So there's a unit count reduction that would have to be restricted either by a deed restriction or an affordable housing or regulatory agreement, if that deeper affordability is provided for. So I've kind of walked through this table, which really is a direct comparison of what the existing ordinance has and the proposed has. Again, we currently have an 8-unit threshold that would be dropping to 6. 15% of the units have to be affordable in the existing ordinance. And now we have a tiered structure, smaller project at 10% or the potential to provide an in lieu payment, 15% for projects of 10 or more at 80% AMI, or 10% for projects at 10 or more at 60% AMI. Fractions in the current ordinance don't round up until 3/4 of a unit. And in the proposed, any fraction in the calculation rounds up. Again, having this very clear up front will result in either folks staying below threshold potentially to avoid having to provide an additional unit, or if they're going to and they surpass having to provide, they may increase a unit count to accommodate for that. The in lieu payment, as we all painfully learned in the current ordinance, was only if an applicant could establish an economic hardship. And the current ordinance, the in lieu is something that can be elected by the applicant and is very clearly defined in terms of what needs to be provided. In the existing ordinance, the payment is really only the difference in the market rate and affordable rate in a sale scenario or in a rental scenario. Again, it's just the difference between the two. And in the current ordinance, it's tied to a 3-year running median average sale price of qualified sales. And that's something that is readily available to be provided by the assessor's department and would be established at the beginning of each fiscal year. So again, people would know very clearly what that option would be. The existing applies to all housing types. And again, now we're proposing to exclude ALR and group homes, and also that an instance where it was really just a reinvestment without an increase in unit count. And then finally, there are many more very specifically, clearly identified definitions in the proposed ordinance that clearly define what 80%, what 60% AMI means, and other definitions that relate to how, again, what inclusionary and affordable means. So that's a summary of the ordinance. And I can say, this has been a long journey, and this is also the first proposal. I have to really, admire the stick-to-itiveness of the planning board members that also at times broke out into a subcommittee to really hammer through a lot of these issues and come up with the current proposed ordinance, along with the support of Judy Barrett, who was assigned to us as a part of a mass housing grant to look specifically at how we can create affordable housing in Gloucester that meets our local need, as well as increase production. And that's what the latter proposals that will be coming actually at your next meeting and throughout the spring and probably into the summer. And also the mayor's leadership on supporting this effort. I mean, it's been a 3-year effort to get to this point. I would track it back to the development of the housing production plan itself, which is a great tool and an education piece for the community. And we're a little bit of time out from that. COVID was not our friend, but that's a solid summary of what the proposal is. And it looks like there's still a lot of people on this meeting, so I hope the public will also engage in the public hearing. But I'll leave it at that for now.
All right, thank you, Greg. All right, is there anybody else that would like to speak in favor? So I'm just going to repeat myself. If you are calling in on a phone, you can press *9 to request to speak. And if you are watching on a device or a laptop, you can have there's a raise hand button. All right, so we have, let's see, David Holden. David, can you hear me?
Yes, President LeBlanc, can you hear me?
Yes, sir. Name and address for the record, please.
David Holden, Executive Director of the Gloucester Housing Authority, 259 Washington Street.
Thank you. Go ahead.
Thank you. The Gloucester Housing Authority Board of Commissioners voted unanimously at their February 10th, 2021 regular meeting to support the Planning Board's proposed amendments to the city's inclusionary housing requirements. The Housing Authority, as many of you know, is required under Mass General Law, Chapter 121B, to advise the city on its affordable housing plans. And we believe that the proposed amendments are superior to the existing requirements and truly applaud the Planning Board for their heroic efforts in undertaking this change. Specifically, we believe that lowering the covered project size from 8 to 6 units will lead to the creation of more affordable units in the city, as that is where we tend to see the greater number of units developed by developers. In addition, the expansion of definitions that can be clearly understood by developers will reduce some of the rancor that has really plagued some of the permitting of past projects. The revised payment in lieu of formula will provide meaningful funding for future projects, and the allowance for units made for affordable units at 60% of area median income really acknowledges what the true affordability level should be for our community. The Housing Authority was involved in reviewing the rents for the Halyard project, which is a lovely project, but we all know that those are not really affordable to the vast majority of people in the city of Gloucester. Our agency currently serves over 1,300 households, all of whom make less than 80% of area median income. They're the people who are working in those jobs that Greg showed in his presentation. We also have almost 1,000 households that are waiting for some other type of affordable housing option. The proposed amendments to the inclusionary housing requirements are an integral part of providing new affordable housing, and they will develop units. They will develop them naturally and in a manner that our community wants them to be developed. And we request respectfully that the City Council approve these amendments. Thank you.
Thank you, David. All right, I'm going to take a step back for a second. And while Greg was sharing his screen, I didn't see our Community Development Director, Jill. How are you, Jill?
Good, thank you. Again, I agree with Greg. We have a great audience and public participation here tonight, so I won't take long. I want to thank the mayor for the opportunity to really explore bold changes to lead to real affordability. Councilor Holmgren and former Council President Lumberg were a part of those discussions. Greg's leadership is always amazing on these things, but it really stemmed from the mayor looking at us and saying, go big. So I want to thank her. I want to thank the planning board. They did a lot of digging on this. The things we're presenting to you have a lot of background, a lot of research, a lot of statistics behind them. And they are what we believe will reach true affordability. So we hope you guys will support us. We also understand that it takes time to understand and process these changes because they are significant and they're not simple. So we are here to answer questions, and we hope we will have your support in the long run. And thank you guys for taking the time to listen to us.
Thank you, Jill. We'll get to councilor questions in a little bit. We'll get through the public hearing part of it. All right, so we've got Chris McCarthy. Can you hear me?
Yes, I can hear you. Can you hear me?
Name and address for the record, please.
You can hear me, yes?
Yes, sir.
Okay. Chris McCarthy, 166 Bray Street in Gloucester. And I'm speaking in favor of the proposal, but I also would hope that there would be a few little changes, and I'll tell you why. I think the planning board, the city council, the mayor's office has done a great deal of work over the last couple of years working on this. And I think that having options is very good. And I think being able to use the both 15 and 10% gives options. And I think that's great. I know that the planning board would like to go from 8 units of affordability down to 6 units of affordability. And I think I would tend to say that if you go down to 6 units, I think you're going to end up, and I think if you look at how many 6 units have been built over the last 20 years, you might get one every 8 or 10 years of a new 6-unit project. I think because of the economics, I think if you, in essence, restrict 1 out of 6 units in any kind of a project, you're essentially you're restricting your project to 16.6% of affordability. So I think it's a big burden. I think going all the way down to the 6 units, I just think it becomes a little bit of a problem. I think if you go through the and I think what would happen is a lot of developers who do both mid-range and high-end stuff would choose to end up building 5 and making them more exclusive, more expensive. Or they won't build it all because an example, I was talking with Jay McNiff today, is if oftentimes if you build one that meets the next category up, you end up actually taking money out of your pocket and time to build it. So you choose not to build it. And I think if you want to encourage both building and affordable building, I think there's got to be sort of a tipping point. And I think that 6, I think, is a point that I think you won't get any 6-unit projects unless they're, from at least the private sector builder developers. I think that if they're publicly funded, you might be able to do those. But over the course of 20 years, I know of maybe 3 projects that have been approved, if that. I think 2 projects that have been 6 units each. I think that if you look into the zoning bylaw book, there's a threshold. After 3 units, it's with the city council with regards to a special permit. From 4 to 6, it's a special permit CC. If you go about 7 and above, it ends up being a little bit stronger review. I personally, I think we need more affordable units, but I just think that you're going to discourage people. And I think instead of 6 units, I believe it should be at 7 at the lowest, for the reasons I just mentioned. So I'd be in favor of, and I've talked with local builders, the guys who do these smaller projects, Jay McNiff, Drew Hale, McCormick. I talked to also Mike Carrigan and also Pat Titus. And again, Pat Titus's project, he would not be able to have done his project like he had done over on Washington Street, which he's doing 3 duplexes. He would have had to go and do single families and maybe 1 duplex and 2 large single families to make his numbers work. So I think there's a tipping point, and I think that a little bit of discussion with some of the people that actually are out there doing these projects. And I know COVID sort of locked everybody away from each other. I think that if there was even a short discussion, just to get feedback and ask questions of the people who are taking the risk to go out and do it, I think would be warranted. To at least discuss the potential for the discussion of going from 6 to 7 units as a requirement. Besides that, I think the only other tweak that I thought, and I made a grid with both the 15 and the 10% from 6 units all the way up to 21 units. And again, once you hit a certain threshold there with the new, not using the 75% of a unit tipping point to go up to a whole unit. Now, if you get 2.1 units, you automatically have to go up to 3. And if you look at, in both categories, the 10 and the 15% that you have at 10 units, you've got to have 2 that are affordable, and 11, you've got to do 2 that are affordable as well. So I think that you don't want to discourage people. You don't want to discourage people, and I think that looking at that percentage, maybe not 75%, maybe something slightly less than that as a tipping point to go up to the next unit. But I think there should be some flexibility going from whole number to whole number. Again, someone put in the 75% or 3/4% in the old zoning bylaw book. I think it's, a little discussion with changing that percent might be, I think that'd be warranted, just see what it would produce and talk, so I think it's very close. I like what's going on, but I just think some of these smaller projects, you want housing, and I just think that some of these, you're not going to get much more housing with 6 units and one of them affordable. You're going to get less because someone's not going to do the 6th. And if someone's in the mid-range, say the $700,000 house, they're not going to do it. And then that person who moved up from a $400,000 to a $700,000 house is not going to, they're not going to have a new house on the market for someone who's moving into the market. So you want to encourage both housing and affordable housing. And I think the more you get down to the lower numbers, and none of the guys that I talked to are working on anything at 6 or 7. We just had a discussion, and I think we'll just find a way to do 5 units, and not go up to that threshold. And that's not going to help the housing market, and it's going to make more bigger, expensive houses for people out of town. So, they don't mind, a lot of developers don't mind doing that. And again, a lot of the guys that will do the smaller project are guys that are in town, the ones I mentioned before. So I just think if there's a chance that this could be tabled for a short meeting this week or next, it would be with Greg and with some members of the board, or however that can be done. I think I would hope we could do that. Because I don't think all the guys I mentioned, none of them knew that this was going on. And there was, so after the meeting last Friday, I just said, listen, what's going on? No, what's going on? Even Pat Titus, who's working on he's working on a 6 unit, 3 lot subdivision. He wasn't aware of it. So, this is something I think that it needs a little bit of discussion, and those are my thoughts. And whatever you guys do. I just think it's going to discourage the lower number projects, and it's just going to feed, it's just going to make the bigger projects. And as you look at the bigger projects, the percentages make a lot more sense, doing bigger projects.
Chris,
it discourages. So that's all.
Chris, I'm going to ask you to wrap it up. We'll give you quite a bit of time. I appreciate it, though. I wanted to get your thoughts, so thank you.
Yeah, no problem. Thank you very much.
Thanks, bud. Appreciate it.
Yep. Okay.
All right, I'm going to jump back to our mayor. She has her hand up, so.
Well, I want to thank everyone on the planning board, and I apologize if nobody's paid attention in the past 2 years. Okay, this hasn't been something that's been happening overnight. This is happening is because we heard the people, and we heard what happened with the Haylard or Fuller School, what you want to talk about affordable being affordable, or you have something that's three units and they shove 6. And so when we hear that, well, you know what, when the threats already, okay, we hearing that, well, we're not going to build that. We're going to go this way, or we're going to do that way. We learned from the mistakes. And if we don't learn from the mistakes, then we're going to keep making mistakes. Just because you can doesn't mean you should. Well, maybe 6 units is not. You know what? Let me tell you something. Affordable housing, if you look at that rate and we look at what we have, the only really affordable housing right now will be at Cameron's, and if it's built with your help, counselors. Because if we pass where instead of having them forced like Fuller School, they started off with 160, then they had to go up to 180 because they couldn't afford it, and they're not going to make money, and then they couldn't make money, and then they went to 200, and out of that 40% was affordable, but I don't know for who. And so they now have 200 units up there. I'm tired. I don't know about any of you, but I'm tired of having people say to us that what is affordable? You know what? The same prices that are there are up top of the harbor that they used to call out of the Heights or everywhere else. Our children are being forced out, and every time, if you all know that if a house is for sale today, they outbid it. They outbid it. So if the house is really technically assessed for 300, it's going for 350. It's like a pricing war. And so we know that, you know what, it's unsustainable. And that's great. You know what? Don't get me wrong. I don't want people to say, well, she doesn't want any growth. She don't want that. But you know what? I like to walk around and know who I'm speaking to than all people we don't know, because they're not going to be able to afford to live here. I think that the planning board with the housing authority and everyone else that was involved did a tremendous job to look at what we have and what we can do. You know, you look at some of the buildings and they're putting so many units in one little square because they want to make it, well, we won't be able to make any affordable. We won't make, well, you're still not doing it, even at 6 or 7, because the number's 10. And so everyone is building 6. No one really builds 7 unless you have to, because, or you know what, you're building 6. A lot of them are building 6 and they want to give you actually the money so they don't have to put it there. And that's fine. That's when you counselors decide with the housing trust of what is affordable and who can actually build. And as far as some of the builders that he was talking about, well, some have approached myself and Greg and find me property and I'll build all affordable, real affordable. I have no problem building. I have no problem building affordable because he's hearing it too. Show me something what you need. Do you want to give me whatever? Should I buy this? What can I do to make it all affordable? I says, what a kind of affordable? 80%? He says, no, I'll do the 30 and 40. I'll do the 60. You know what? We need that. And you're hearing from the Gloucester Housing Authority. They have no room for expansion. They have no room for expansion. All of our elderly projects are full. And there's used to be a 6-month waiting list. Now it's a 4-year waiting list. And Section 8 is closed. Okay, so the only thing we really have for the everyday working person, we have all these programs in the city that we're working partnership with Wellsprings to have people go get training in schools and hospitalities and LPNs and nurses aides and all these things to make a little bit more, but where are they going to go? They still need that affordability and they still need that. I'm asking you to look at this and to trust your planning board and Greg that not myself, but they have been working on with the community development for over 2 years. So Paul Lundberg hasn't been here. Jen wasn't even council when we sat there and I said, Jen, are you running? Because we need affordability and this is not affordability. And you know what, we're going to be pushed out because everyone thinks, oh, it's the mayor. She wants all these things. No, I don't. I want to give fair opportunity to see my children can't, but maybe your children can be able to live in Gloucester and stay in Gloucester. We're all hearing it. Everywhere in Massachusetts, it's overpriced, and we know that. And it's not saying that we're not friendly and we don't want people to come here because we already built for that. That's 200 units that are going to be rented out, and we know that basically 90% are going to be not from here. And what do we learn from that? So we still have all these people that need houses that are living with, their parents, grandparents, doubling up, tripling up to be able to afford something. So if they can't afford to live here, then they're not going to afford to work here either. Because during the summer, pre-COVID, and anyone can ask the chamber, they couldn't find help. Tornos was looking for dishwashers even at 18 an hour, couldn't find it. If you live in Peabody, you live in Salem, you're not going to come to Gloucester. The commute's not worth it because there's no place to live here. So you have to remember that too. And then if you want our people to live here, ones who don't have transportation, they have to get around with either the taxi, the buses. And if we don't have any place for them to live, we're pushing them away. And don't say, well, they can come in by train. We're building Gloucester and it says build for our future, but Aren't our children our future? Do we always say our children are our future? Well, they're here. And if we push them away, then you know what are we going to do? We want people to come in. I'm not saying I want, because we have mixed culture here, more people coming in. That's great. People buying the houses. But you know what? Bigger and better is wrong. Let's complete the heritage and the diversity that we have and the things that we have. And the only way we're going to do that is be able to make sure that we do have housing. That's number one. Number two is employment. You guys have worked on that. You approved a TIF, another 25 new jobs. Well, even if it's minimum wage or a little bit higher, where are they going to go? Eventually, he's going to have to keep looking for help, because who's going to do it? So please, it's a whole combination of not only affordability, income, school, everything is all around of where you can live. We're building a new school, but who's going to enjoy it if we can't keep our children here to use the school? I'm just asking you, trusting Greg, trusting the planning board that, are appointed and you work with to make sure that they came up with that. This has to be a reason why they went from the 10 to the 6 and the 15% and the 10 and why of all of a sudden they said, well, you know what, if you don't want to build it, then you can give us the money and we'll build it. There's got to be a reason. It's because you know why? Because they know, and we all know, that with the council's help, we will build affordable housing. We have that going on with Cameron's, but the ones at Middle Street, look what you donated for that. Well, I'm sorry, you granted for the Affordable Trusting House to do that, and we're working together. So let's keep an open mind. Let's keep our future open by keeping affordable housing in Gloucester. Thank you. Real affordable housing.
Thank you, Mayor. All right. Once again, if you are calling in on a phone, you can press *9, or if you are on a device or a laptop, you can raise your hand. Up next, we have Sunny. Sunny, can you hear me? Hello, Sunny. I see you unmuted yourself. All right. I can't hear what you're saying, Sunny. I'm sure you can hear me because you've unmuted yourself. So I'm going to keep you where you are and see if you can't fix what's wrong at your end. And I will go to the next person. And we have Peggy. Peggy, can you hear me?
Yeah, yes, I can.
There we go. Can we
Thank
have your
you.
name and address for the record, please?
Sure. My name is Peggy Hegarty-Stuck. I'm the Executive Director of Action Inc., and we're located at 180 Main Street in downtown Gloucester. I'm here to speak in favor of the proposed changes to the ordinance and to thank the planning board members and the mayor and the community development staff, Jill and Greg, for all the hard work over the past couple of years on this ordinance. I think one point that's important to remember is that in order to really address the need, we're going to need a range of tools. And this is one of a number of things that is going to help us get to where we need to be to serve the people that live here. We just finished our needs assessment. And as you all know through the city documents, there's 42% of the folks in our community are cost burdened by their housing, which is a large increase from even 6 years ago. So the need is growing. What we've seen during COVID is an even stronger need. We've helped over 170 households just to keep their housing during COVID through rental assistance. So I think it's more important than ever that the city be bold around affordable housing. Every needs assessment we do every 3 years, it is the top need across the board on Cape Ann, particularly in Gloucester. And so I think that we need to start with this more comprehensive approach, because at our agency, as you all know, we help try to prevent people from losing their housing. We try to help them find housing. We house them during emergencies, and we're also building housing. But even with all of those activities, it's still not enough. So it's going to take a much larger, more complex, more almost surgical effort. to kind of get to where we need to be. And I think this ordinance is a really good example of that. And the other thing I would just say is that, as David Holden mentioned, our projects use 80% of the area median income because that is what's required based on federal regulation. But really in Gloucester, our median income is nowhere near that, nowhere near the Boston region that we come out of on those numbers. So things at 60%, that's really 60% of the area median income and lower is where we need to be for it to be truly affordable for people. And just as an example, the Harbor Village project at Cameron's that we're doing with the North Shore CDC, the maximum rents are at 60%. But for folks making less than 60%, that rent is adjusted. So those numbers you saw on Greg's slide, that's the maximum rent. And that is only for people that are at 60% of the area median income. So folks making less money will accordingly have the rent adjusted down so that they aren't cost burden. So I think I would just wrap it up to just reiterate that I'm strongly in favor of this and I appreciate all the work and I think it's the right thing to do.
Thank you, thank you, Peggy. All right. Up next, I'm gonna see if I can get Sunny real quick again. Sunny, can you hear me? Like I said, I'm sure you can hear me. We can't hear you on our end. Go to the next one. I'll leave Sunny there for one more minute. But real quick, Sunny did send a letter of support for this change. Just for the record, I'm sure she's here to speak in favor. She did send a letter in favor. All right, so I'm gonna go over to Amanda. Amanda, can you hear me?
Yes, can you hear me?
Yes, we can. Name and address for the record, please.
Amanda Nash, 8 Exchange Street. And I am here to speak in favor of the ordinance. I also really want to thank Greg for all the work he did and all of the planning board people and Jill and Judy was amazing. I was in on some of the discussions at the beginning, and I just want to reassure people that pretty much every conversation about this ordinance had to do with, you know, what we want versus what we can get. The developers were always part of the conversation. It was not, we're just going to ask for our pie in the sky. It was about, you know, what is the compromise between what we need and what we want to get here and what developers will be willing to do. So this was extremely well considered. I really like the way the ordinance turned out. I like the 6% threshold. I like the 6-unit threshold rather. I like the choice between building 60%, 10% at 60% versus 15% at 80%. I'm sure you know what I'm talking about. So you've heard this over and over. I like those choices. I like the fact that the smaller developers can choose an in lieu and that the in lieu payment is very well defined. So I think it's really a well-written, well-considered ordinance. One of my concerns with Gloucester is that I feel like you may have heard me say this before, I feel like we often sell ourselves short. And, you know, people were concerned with the Halyard apartments that if we made them build the affordable, they'd run away. We're always worrying about the developers running away. They're not going to run away. People love Gloucester. People can make money in Gloucester. I think we need to be a little tougher about what we need and getting what we need. And I also feel like Judy Barrett, the consultant, has done these ordinances all over the state. She is so experienced. She's well aware of the issues between asking for too much and not getting anything. She's got all that in mind. And I think we've come up with a really good ordinance. And you know, the proof will be in the pudding, but let's not get shy about it. I totally agree with what the mayor said. And I hope we'll really go forward with this as it is. I think it's really well done and really well considered. Thank you.
Thank you. Amanda. All right, and all right. So in favor or in opposition, we have Teresa. Teresa, can you hear me? Tracy?
Yeah, can you
Mark? Yes.
hear me?
Yep, name and address for the record, please.
Yeah, my name's Tracy Mark and I live at 309 Essex Ave. And I wanted to express my support for the zoning ordinance and thank everyone who's worked so hard on this. I was a little rattled by the developer call because I'm not a developer. I am just a resident of Gloucester who has a family that has had difficult situations finding housing. So I kind of view this as what the community wants, and I respect all the work that's been done because you all have represented everyone in the community, from the developers to the people looking for housing. So I kind of view this as our community ordinance for the community. And so I just want to mention a couple of the great things I think in the ordinance, and that's dropping the number from 8 to 6 to trigger the affordability part of it. And I kind of hope that maybe that will actually lead to a little bit more money in the Affordable Housing Trust by doing that, because the payment in lieu of process option has been streamlined and the calculations very clear. So it's kind of my hope that we'll also get a little more money in the Affordable Housing Trust. And then that money, that could maybe start to inspire the Affordable Housing Committee, and they could be more proactive and energized if there's some money coming into it, and then different kinds of projects, smaller projects could be funded. And so I like that part of it. And I also am very happy to see the option of having the reduced percentage, the 10% at the 60% AMI. And that could have meant, if we had that, I was thinking about the Halyard Apartments, and that could have meant that we could have had savings. We would have less apartments. I think it'd be 20. I'm sorry, I forgot how many less apartments we would have, but it would be $350 less. So it would meet more of the needs of people in Gloucester if we had that option for the developer. So I feel like it's called an inclusionary zoning ordinance for a reason. It's to include people. It's not called an affordable housing ordinance. And I really feel that, it benefits all people, not just some. So thank you again for all your work. I hope you vote yes. And I look forward to seeing how things play out. Thank you.
Thank you. All right, we have Sunny back. Sunny, can you hear me?
Yes, I can. Can you hear me
There,
now?
Yes, we
Great.
can. All right, thank you.
I changed devices. Thank you very much.
There you go.
Sunny Robinson, 20 Harvard Street. I note as we come to this very important hearing tonight that I have been working on affordable housing issues for 25 years in Gloucester, and we're still way below where we need to be. I therefore urge the City Council to pass these ordinance changes intact as they are, without amendment, so that we can take a great leap forward. I want to I did a written statement, so I just want to highlight a couple of the things in that statement. Number one, I want to say again what Greg was saying. We face an area mean income of 119,000 when the actual Gloucester area mean income is 65,000. 50% of the people who live in Gloucester have an income below that area mean income threshold. And I have no shame in telling you that that's me and lots of other people, lots of city employees, whether still employed or whether retired, and that in fact, we need to make housing available so the people of Gloucester who have worked for Gloucester in Gloucester and raised their kids here and are paying for building all these schools with the state help can actually continue to stay here. I'm fortunate in having a steady income, though limited. I have savings. I have a house that's paid for and a mortgage, but there's no way I could ever move out of my house if I couldn't move into affordable housing. And even when you look at what Action is having to structure in terms of minimum income to qualify for a one-person unit, I don't earn their minimum income. There would have to be some kind of a adjustment to the way in which assets play into that. I think the 6-unit threshold is extremely important and is at the heart of the creativity of these 2.5 years of work from the planning department and the housing production plan. Now, I realize on first glance, it is challenging for developers, but there are many options and there are many beautiful options to pursue. Number one, if people don't want to build, they can do the in lieu of payment for the 6 to 9 unit threshold of a building. And in fact, it's a realistic amount of money that would contribute money to the Affordable Housing Trust, as Amanda pointed out, that would actually let the trust foster some other kinds of affordable housing. And yeah, at 6 units, you have to do one that is affordable, but you still only have to do one at 7 or 8 or 9. So you can spread the cost of that one affordable issue out over not just 6 units, but all the way up to 9 because of the thoughtful way the planning board constructed the ordinance. So that is a huge option for people to consider. And in fact, you could even go to 10 units, still only have one at 10% if you did 60%. So I think we as a community not only have this remarkable opportunity to foster affordable housing, but to invite our local developers like Chris McCarthy to really join us in that effort of making this community affordable for everyone who lives here. So I sincerely urge you to pass these ordinances without amendment, without adjustment, and let's see what we can continue to do to make housing actually available to people who live in Gloucester and want to stay here. You want me to move out of my house and move into an affordable apartment at someday because you as a community want my house to be available for a young family who wants to stay here. So to make that possible, there needs to be affordable housing, not just senior housing with services, but housing for people in my age range who still, thank goodness, are independent. So please pass this ordinance and thank you for listening.
All right, thank you, Sunny. I'm glad you were able to join us also.
Me too.
All right. Is there anybody else that would like to speak in favor? All right. Zach, can you hear me?
I can. Thank you. This is Zach Jilka. I live at 10 Brightside Ave in Gloucester. Fairly new to the affordable housing conversation, but I do think it's critically important, and I wanted to make sure I voice my strong support for the proposed ordinance as it's written, and would strongly urge the council to approve it without amendments. The thing I really would like to second everything Sunny just said, but also I really just want to focus on that 6-unit threshold and how important it is that I think that remains in place as it's written and not raised to a higher threshold. I think we are in desperate need of affordable housing, and I really would be concerned about losing, some of those units if it were to be raised above what's in the proposal. I think that's become increasingly obvious over this past year as prices have skyrocketed, making it really pretty untouchable for a lot of working class and even middle class families. And I think that trend is going to continue. And one thing I would just raise for your consideration is Gloucester's a pretty desirable place to live. And with increased telework and remote work, that a lot of companies are going to be looking at. There's just going to be more and more people from cities that have higher incomes wanting to live out in Gloucester and working remotely and putting even higher pressure on the housing market here. So I think something like this is just really critically important to put in place so that the people that have lived and worked here for a long time have a place to live, especially those that have helped us through this pandemic and worked on the front lines. So thank you for listening. I also submitted a written statement and I appreciate your attention to this.
Thank you, Zach. All right, is there anybody else that would like to speak in favor? All right, seeing none, is there anybody else that would like to speak in opposition? Once again, you can press *9 if you're calling in on a phone, and there is a raise hand button if you're on a computer or device. All right, seeing none. Madam Clerk, do we have any communications?
Yes, we have communications in support from Larry Oakes of 4 Clay Court, Deanna Fay, no address given, Melanie Murray Brown, 7 Fremont Street, and Andrew DeFranza, the Executive Director of Harbor Lights Community Partners. And also we have written communications from Sonny Robinson, Zach Juckla, who just spoke, and Tracy Mark.
Thank you, Madam Clerk. Do we have any councilor questions? Councilor Gilman.
Thank you, Counselor. I've got a question for Greg Cadmatore. I've got my notes everywhere, so I'm a little disorganized. I'm sorry. I have little cheat sheets. Can you elaborate a little bit more on how this affects renovations, rehab, assisted living, and what was the fourth? Housing groups. I think those were the 4. You had said that in the last P&D meeting, and you were talking about how the threshold, these types of developments are not part of that.
Yeah, so one of the differences in the current ordinance, which really applies to all types of housing, is that there are some that are excluded from having to provide affordable housing, and that's group homes or assisted living residences or renovation projects that don't increase unit count. So if there's, again, if the threshold is 6 units and there's a 6-unit development that's out there already, that somebody chooses to renovate or even potentially expand but not increase the unit count, it would not apply. So it's really about new construction of projects, again, at that threshold. And I would respond a little bit to what was raised as some of the critique of this. Again, this isn't a forever ordinance. We've had an ordinance in place for quite some time. This is a proposed amendment. It's really hard to say exactly what the impact will be. There's obviously several different thresholds built in this ordinance. And to the point, I think that Sonny raised, I mean, there could be the possibility that because of triggering an ordinance, somebody might consider increasing the unit count in a project. So, it's a matter of, there have been surveys of all the inclusionary ordinances in the state. They range in their threshold. This probably is definitely on the lower end of threshold of 6 units to 10 units. There's been a trend of decreasing the threshold for this very reason, because we're being the community is being outpaced by market rate development to the point where it's also driving the cost up because the product that's being developed is also higher end. So I think there's always going to be the issue of threshold when you get into the 10+ range, and as that turnover of when the next unit needs to be provided, whether somebody chooses and decides and says, maybe I will try to recapture or in their pro forma, seeing that there is definitely a cost to providing affordable housing, that they may increase unit count. So I think whatever threshold you pick, whatever percentage you pick and how it gets applied is gonna, the development community is gonna respond. You know, kind of to that same argument of there aren't too many 6-unit projects out there kind of speaks for itself in terms of whether or not this may even have an impact. You know, if we're seeing more, you know, 7, 8, 9-unit projects to begin with, you know, the question is there really an impact of that 6? We've also seen smaller projects that are entering the market, $800 to $1 million per unit. And, you know, that's part of, you know, this is clearly reaching into somebody's pocket. The community has identified a need. It has the ability for developers to propose a lot of different types of development. Maybe one of the other things I didn't, you know, mention in the background, or maybe I did at the initiation of the ordinance. Gloucester's pretty unique in providing a lot of options for types of development. We're one of the few communities that has a 2-family as of right, and you can see a lot of that happening in the community because the development community knows that they're getting more out of a development if they develop, in some instances, a 2-family versus a 1-family. On the North Shore, you know, when you look at the income levels, clearly there are some communities that are very close to meeting that median income of $119,000. And they're, you know, when you look at that distribution, Beverly, Salem, the cities in the North Shore area have a lower median income. So the need is definitely there. How it gets provided for is dictated by you as the legislators, how to meet that need. So, I mean, the other thing that I said to the planning board as they were, you know, moving this forward to the council, not only through the initiation, but after the public hearing, is we're all going to get to see how this impacts the development community. These are generally projects that will be either before the planning board as a subdivision, cluster development, an open space residential development, or before the city council as a multifamily project. So this is an opportunity to also monitor how it impacts things, because again, you will be the ones that will see a 5-unit project come before you, and you'll ask that question. I wonder what the opportunity might have been here, or the opportunity lost. And it also doesn't mean that we continually need market rate units as well. So by no means, this is not a layup for the council. It wasn't a layup for the planning board. That's why it's taken so long in its development. It's a very complex issue. Some of it is out of our local control to begin with. It's a national issue. It's a state issue. It's a regional issue. So, and that's just a little bit of a response to some of those concerns. I understand, you know, fully that any project that meets the threshold will now have a financial impact on it, whether it provides an affordable unit that otherwise could have been marketed at a much higher rate of return, or in providing an in lieu payment, which again would come straight out of the development cost. But so that's what I can respond to for now.
Thank you, Greg.
Councilor Cox.
Greg, thank you so much for your work on this and the committee. It's been a long time coming. Were any developers on the committee? And at any time, did you guys reach out to anyone who does the building to kind of talk to them about the pros and cons?
So I've had some individual discussions. There wasn't, the working group was really the permitting body with the support of Judy Barrett as our consultant, again, who has worked in every community, well, not every community, but dozens and dozens of communities in specifically on affordable housing. There wasn't necessarily, there wasn't a developer forum. Obviously, if you track the planning board agenda, it's probably been on there more than a dozen times in the last year alone, either on the regular agenda or in subcommittee, as well as, you know, how it's been in paper articles and that type of thing, but there was not a specific forum.
Okay, are you comfortable with the work that you guys did, that that you've put it out there enough to where somebody should have seen it by now if they were a developer?
Given the amount of noticing that does happen, I mean, again, we are in this unique environment right now, but obviously that's why things are noticed in the paper, as well as articles in the paper. So, I mean, I can't speak for how people consume information at this point. There's so many different channels, Mayor's Facebook page, community forums. There was, I mean, the discussion of affordable housing is one that's been ongoing for about 3 years now. In its final permutation of this ordinance, that's what this public hearing is for. But I think, there's been a lot of opportunity for people to review and discuss. If people feel like they are only finding out now, I mean, I know Chris was at the P&D meeting, but I can't really say how people track, what's going on with ordinances. I mean, if they're in the development community, I would think that that's something that would be first and foremost in their minds as they are developing in this community.
Thank you. Based on his input earlier in the meeting on this item, do you think there's any changes that you would have made or could have made if we offered a continuance to the next public or next city council meeting?
Again, I think whatever from the one issue around percentages, for instance, there's always going to be an instance and where you're going to start to have to supply another unit based on the calculation. And I think the old ordinance was forgiving on the developer side. The new ordinance is very targeted and saying, this is what you need to provide. It is trying to provide more affordable units and also, again, capturing or providing them in more developments. So that's very, very specific. A lot of discussion over the last 2 years in its development. The tiering of things is actually, in my mind, it's advantageous over the current ordinance, which just says, this is what you have to do at this point. This now provides some options, again, at that 10% level for the smaller project, which is basically an 8-unit project right now has more opportunity under the current proposal than it does under the existing ordinance. Again, there's some movement that people will respond to. They'll either say, well, I'm going to, again, to Chris's point, maybe provide less units and be sub-threshold, or maybe propose increased density because they have to provide affordability. So, I mean, it sounds to me like a lot of the discussion is around the target of 6. Again, that's a trend. It's because trying to provide and also create opportunities, additional opportunities. For instance, if someone to use the in lieu option. And again, it's not there's so many variables in this in terms of what somebody might propose, what's their target market. In instances where the closer a market rate unit is to an affordable unit, the likelihood of somebody producing the unit in the project is what we would like to see. As things, start to, hit, or propose a target market that's much, much higher, maybe it makes more sense for that development to provide an in lieu payment so that they don't have such a disparity between incomes in a project when they're really on the high end. And that in lieu payment was designed specifically for it actually to be meaningful for the Affordable Housing Trust to use. The difference as in the current ordinance, that small number, that kind of delta between a market rate and an affordable unit, again, it's whether or not that's something that really can be effectively used to leverage some other project by the Affordable Housing Trust or the development of other programs. So, I mean, I hear that concern. Obviously, it's something new. It applies to more. In some ways, that may sound like it's asking more to be provided by a development. This is one strategy. And I think, you know, the opportunity is to see how it functions. We haven't had a ton of units being created under our inclusionary ordinance, as you know. Probably the Halyard development is one of the most, you know, in the most recent past. Beyond that, we have seen maybe smaller projects. So again, it's trying to see what's being developed in Gloucester and try to have it start to be part of the solution in providing the local need.
Great, thank you.
Sure.
All right, thank you, Counselor. Any other counselor questions? Counselor McCarthy and then Counselor Nolan.
Yeah, for Greg. Greg, obviously this group reached out to some of us this week. I see a lot of experience there with building in Gloucester, a lot of locals. You got Mike Carrigan, Drew Hale, Chris, Pat Titus, Jay McNiff, Frank McCormick. There's a lot of experience there, and as much as I'm in favor of this ordinance, I also would be in favor of at least listening to their input on this. If we put this off, is there a mechanism for hearing them in a reasonably short period of time? I mean, we've been working on this for 2.5 years. I'm just wondering if there is a mechanism to hear them and then come back to us.
You could take as long as you'd like. You just opened a public hearing this evening. So the timeline is your timeline to receive the input that you need to make an informed decision. So if this public hearing is continued to another date certain, has to be a date certain, you can continue to take public testimony.
With all due respect, I realize that this is time for counselor questions, but I have to say this is our mechanism for hearing the public. And as has been repeated several times, this has been in the works for 2 years, more than 2 years. There was a working group that was not a secret. I'm not sure. I mean, I completely sympathize with the points that have been brought up, but people are hurting now. I thank Peggy Hegarty Steck for reminding us that we voted for rental relief to be distributed to Action shortly after this pandemic began. And I guess this is something that we need to deal with as a city, but there are public meetings and there are opportunities for people to listen and to participate. And also now we have one whole year's worth of meetings, public meetings that have been recorded and are accessible on the city website. Any one of us can take a phone call. Any one of us can answer an email. But I am personally invested in seeing this pass, and I've considered the viewpoints of people who've reached out to me as realtors and as builders over this past weekend. And I feel very strongly that the campaign promises that I myself made and the people that I work with every day, not as a city councilor, but as a nurse and as a person who works in health and human services, they desperately need our help. As Greg said, Massachusetts has been a boon for people who are property investors or realtors or lawyers or people who are otherwise involved in the housing market, but it's a huge challenge for people who don't have housing. Thank you.
Thank you. I appreciate it. We could save that I understand your frustration. We'll let us get through the counselor questions first, if you want to express, but I understand your frustration.
Thank you.
Counselor Gilman?
I have a question for, through the chair to Greg Catamatore. Again, sorry, Greg.
Is there anyone else? Anyone?
It's you. I was in my many pages of notes that I've been taking since listening to everybody. I was intrigued by something that Sunny said, and that was the developer can spread the affordability up to 9 or 10% of the projects, which would include the in lieu component. I was hoping you could just expand upon that, because I think that's the matter that's on our minds right now. And I thought that her comment was very well taken.
Yeah, I think that goes back to my response to Councilor Cox. Again, the question is, by setting the threshold, are you more likely to have somebody meet the threshold and then propose additional units, or go sub-threshold and not have to provide affordability? So, I mean, again, whatever mark that you set may have that impact. And I think, you know, the intention is to try to essentially have more developments contribute to the problem. So, you know, that again may be that if at 6 have to provide the same amount of affordability at 9, you may see those projects increase their unit count. And I think that's something that the council has to be aware of the impact when a project comes in. Somebody comes in with an 8-unit project, understanding what you're gaining from having that as an 8-unit project potentially, rather than a 5-unit project. If the area is cited appropriately for it, has the capacity, has the public safety and the access and the utility and everything else that goes along that a developer has to contend with to ensure that the development can fit where it's being proposed. But that's what would be the eyes wide open with this, is understanding that, and this is a whole nother discussion about density and the difference between a 6-unit project and a 9-unit project and what its impacts might be. But recognizing that you're also gaining affordability in a project when it's proposed at that level.
Thank you.
All right, is there any other council questions? Councilor Nolan.
I do have a question for Greg. With this inclusionary ordinance, does that also include cluster development? Would that carry the same weight towards a cluster development?
Yes, yes, it does. And in a recently approved cluster development, and one that has had a significant amount of pre-application. I think I just lost Councilor Nolan. Oh no, there you are. Somebody else left off. I'm trying to keep my eyes on you. It's been made specific, a condition of the planning board approval, basically cross-referencing to the applicability of the inclusionary ordinance. So it would.
So if this took effect, at what point would that go into effect on any incoming or new cluster developments?
So it already is a trigger under the current ordinance. So there's been one that's been approved that has an inclusionary requirement. And again, it would apply to anything that is applied after the first public notice. So if you approve this ordinance as it is, any cluster development that's applied for moving forward would have to comply with the proposed ordinance if adopted.
And what do you have in front of you for proposed cluster
So
development?
we have had, there's one that hasn't had any formal pre-application with the planning board. There's another that has, that I believe the intention is for that application to be filed very soon. Based on the calculations and size of project, there's really no difference between the two, other than the project might have the opportunity to provide deeper affordability at 10%, 10% of the units.
Thank you very much, Greg.
Sure.
Any other council questions? All right, so Greg, we heard Chris earlier talk about the number of 6 units that have been before us. Can you touch on that?
How would you like me to touch on that?
Well, how many have been brought before us? Like you said, 6 is the bare bones minimum. And you said something about the past 20 years, maybe 2 or less than a handful.
I don't know if he's combed the records of city council special permits. I haven't specifically either. But again, I think it's just a question of threshold of what will the impact be? Will it result in a project that's proposed at 5 units, or is there the possibility that it might come in at a denser project at 7 or 8? So it's, again, current threshold is 8. And the proposal, from the collective of everybody that was involved in this proposal was to move it down to 6 so that the affordable need is addressed in a broader way than it currently is.
All right. All right, I don't have any more questions. John, did you want to finish up what you had to say? I know Jen.
Sorry.
No, that's okay. I just want to make sure John got Council McCarthy got all his questions in before we move forward.
Yeah, my thinking was that, we've all, and I don't know how many of you heard, but I've heard from a bunch of our local developers that they weren't heard, whether it be COVID or whatever. And my question was only to Greg, how much would it slow down the process if we revisited it and allowed these people to at least get their input in? That's my goal in asking the question to Greg. I didn't want to debate with Jen, but I just wanted to know, if we continued this, would his committee be able to meet with them and at least take their input?
Well, I would at this point say the input has to come to you. We're at the stage of a public hearing. So anything that if there's folks that want to provide their comment, it should go to the council at this point. It's no longer with the planning board. They've made their recommendation. It's already gone from P&D. So if they have specific recommendations that they want to make to the council, they should be made to the council at this point.
Okay, and that was my question, Greg, whether there was a mechanism for it to go back to you or whether it had to stay here.
Oh, okay. I'm sorry. I thought you were just talking about the timing, which is completely at the discretion of the council at this point of when you want to keep the public hearing open to, when you want to close and take action. So if you chose to continue to solicit more input in the public hearing setting, you can choose to do that.
That was my question, Greg. Thank you.
Hey, John. Councilor Gillen, did you have another question?
No, I just wanted to comment on that. But
yeah, well, hold
another
on
question.
Hold on a second. Councilor Cox, you have a question?
Yeah, I mean, I'd like to further carry on what Councilor McCarthy is saying, is that I don't think it should come back to us. I think it should go back to your working committee, because you guys are the one with the more intimate information, and to see how their concerns could be addressed. I think it's fair that, like all of us, we were elected to take in the public input part of it, and that's what we're doing tonight. And someone has spoken up and said that they haven't been heard, and I think it's important for that portion to be heard.
I have a
So
point of order.
wait.
I have a point of order.
So I would like to see
Hold on.
if it can go back to the committee.
If we did that with every public hearing,
We're
we
not
would never
doing
get
it
anything
public hearing.
done.
I have a right to be able to ask this question.
Okay, and I have a right to call a point of order.
All right. I'm gonna reel it in a little bit, guys. Councilor Cox, so your question, so for it to go back to the planning board, to answer your question, we would have to make a motion and vote on it. So basically, that's the trigger mechanism to get it back to
So
planning board.
I just want to be very clear on the procedure. So initiated from the council, referred to P&D and planning board required to hold a public hearing. They held it. They made their recommendation. P&D made their recommendation to the council. The public hearing is still open. And if you're suggesting to encourage people to provide more feedback, it should be through the clerk's office to the city council. And, you as the legislative body can recommend additional changes to the ordinance.
Right.
The only thing I've heard so far tonight is threshold. I think, again, what happens at the larger project, 10 unit greater, and the impact of rounding, again, is very specific and targeted to increase the number of units that need to be provided in a project. and may affect a developer's proposed density or project design and perform as they develop it. So it sounds to me like most of the focus is on threshold, and you've received this body of information on why the threshold was chosen. And it's the legislative body to decide whether you're going to take the recommendation of the planning board and P&D or amend the ordinance at, after the close of the public hearing.
Right.
So I think if you want to take input, it's at the council level. It's not sending it back to a working group that has no authority, only to help develop a proposal. And the planning board has already closed its public hearing.
Right. So if we do send it back for some reason to planning board, it would have to start from square one with them, with a public hearing again and everything else. So it would take quite a few steps back and not just have a recommendation on the fly. We're able to amend it up here at council if we want to this evening. Like Greg said, after we close the public hearing, at this point, we're just procedurally talking. We're still in the public hearing part of this at councilor questions. And this is why we're trying to answer some of these councilor questions. So Greg is correct. If it goes back to planning board or planning and development, that might be the best route to go back to if we were to vote to go back. Councilor Gilman.
Yeah, so we're all kind of discussing this, so I'd just like to weigh in as Chair of P&D. I wholeheartedly agree with what Greg just said. I think that this process has been in place for 2 to 3 years.
Councilor
And I
Gilman,
see-
before we get into it, I don't want to get into the deliberation part of it. It's more of a-
I know,
it's-
but
it's
Council
more of a-
Cox and Council Holgram both said things that were kind of discussing what their thoughts were on this. and-
Right. Well, Melissa asked if we could bring it back, the mechanism, and Jen called the point of order. So I'm just trying to justify the procedural part of it. So if you want to help explain the procedural part of it at P&D, rather than tip your hat on which way you're going, because I think we're going to be getting into the weeds. If you kind of deliberate on how your feelings are on the ordinance. We don't have a motion in front of us right now. I'm just trying to be cautious, throw caution to the wind. That's all I'm trying to do. Okay.
So on that note, would you like me to make the committee recommendation?
Hold on. If we don't have any more counselor questions, are we all set with counselor questions, everybody? We understand that. Greg, you wanted something? to say?
Not a counselor, but I just want to be perfectly clear. No one said this was easy, but the ball is in your court.
Right.
The process has come to the conclusion of a proposal in front of you for you to take this position on. And if you, based on the public hearing, choose to provide an amendment to the proposal, that's an outcome. But, procedurally at this point, it is at the public hearing stage of the city council for you to take the input, not just from me, from the people that spoke this evening in favor, from those that spoke sort of in favor, with some suggestions. And if there's more input that you're looking to take, then I would ask you should be asking for that to be coming to you through the clerk's office for you to consider. And if it comes in the form of a specific critique, then you have that to consider as well. But it's either the form that it's been provided for from the planning board, which I think is consistent with what was recommended from the standing committee, and then for you to decide whether there are nuances or things that have to be amended further, because you are the ones that legislate.
Right. Okay. Thank you, Greg. Any other councilor questions? Val?
So procedurally, I see us as having 1 or 2 things we can do right now. Number 1 is you could continue the public hearing because you haven't closed it.
Right.
And continue it to the next meeting. So if the 4 or 5 developers that Chris McCarthy spoke about wanted to come, they could certainly do that in 2 weeks. Or I make the committee recommendation, which is our motion coming out of P&D, and we get into the nuts and bolts of what this meant, and we get into the discussion on whether to amend or not and vote. So those are the two options that I see
Correct,
that are in front of us.
correct. So is there anybody that would like to recommend to continue this, or do we want to go to committee report? Councilor Cox.
I think it's fair that we continue it for till the next meeting and allow people to communicate with us on their objection or possible changes. We've heard from somebody this evening that said that they weren't aware of what was happening and would like to provide input. So I think it's fair that we continue it, but it's at the will of the council.
You want to make that in the form of a motion?
I move that we continue it until the next city council meeting. Yes, Greg.
I will not be in the state at your
Greg's-
next city council meeting. I
Greg's
just
gonna
want
be
you to
on.
be aware of that.
I
Greg's
think
gonna
you've
be
done
on-
all the heavy lifting.
Yeah.
And I will be here. Jill will
Yeah.
be here. I think I got this.
Thank you, Jill. And Greg, you deserve your vacation.
So I second it.
All right, so motion's been moved by Councilor Cox and seconded by Councilor O'Hara. Is there any councilor discussion? Councilor Cox.
I would prefer to err on the side of caution and get the input than not get the input at all and vote on it. I think it's only fair.
Okay. All right, so we have a motion and we have a second. Is there any other councilor discussion? I don't want to take a straw poll if that's the case, but Councilor O'Hara.
Thank you. I obviously this has been a very detailed discussion, a lot of information provided. We had Mr. McCarthy, who spoke at P&D, spoke tonight. He certainly is a respected person in the community. I think we, if we owe it to them, I believe, and to the citizens of Gloucester, to hear from the professionals on that side of the fence. Not that we haven't. Greg is certainly a professional, but I think we owe it to the citizens of Gloucester to hear from the other side. And to delay this for a brief period of time, I understand we need to create housing, but I think we need to get it right.
Okay. Anybody else? Council Holmgren.
Is this the precedent we're going to set for every public hearing from now into eternity? I'm against this, just for the record. That's all.
Thank you. Council Nolan.
I agree with Council Holgram. We heard from one person tonight that was in favor for most of the bill. He used a lot of names. I respect everybody that he had mentioned. They all knew about the meeting tonight. None of them chose to speak or to be on it, and they were well aware of it. I don't want to go down a wormhole, especially on the notification. Everybody's crying about notifications. They're out there. It happens. I think that it's an ordinance that's a live changing mechanism. We can go with the hard work of the planning board and the planning and development committee and see how this works. It can always come back. But after the public hearing tonight, I'm ready to move on the motion.
Councilor Gilman.
Thank you, Counselor. So I would like to piggyback on what Councilor Holgram and Counselor Nolan said. First of all, there were 6 members of the council that were on the Zoom call. I think we got into the nuts and bolts really well. I also think that, I see Attorney Ellison is on the call. She's an attorney who represents applicants, and she's been probably to the last 3 or 4 meetings on this topic. I just think that people that are builders have been going to meetings, and if they miss this one time, I feel sorry, because I certainly respect what you do. I like you all, but it just doesn't seem fair to the process that we've gone through. So I'm not going to be voting to support the continuation of the public hearing.
Thank you, Bill. Barry, Councilor Pat?
Yes, thank you. Again, first, thank you all those that have done all the work on this over the last couple of years. And there have been, difficulties with maybe everybody not being, able or think they got the information or whatever to participate. I know that when Chris McCarthy spoke today, he talked about a number of other contractors, and some of the councils have even mentioned other contractors. I'm not sure why, if they had input, why they haven't, not one of the others did I see on the list here. And Chris was at the meeting, at the P&D meeting, and spoke, etc. And I would not like to see us, again, as Sean said, go down that hole and delay every time someone comes and says, I didn't get the notice, I didn't get the chance, etc. So at this point, we can go ahead and we can vote either for or against, or to delay. But if it is to pass, there's nothing that says that any of those people can't come together as a group, and changes can't be made even on short notice from there. But I won't be supporting delaying any further.
Thank you, Barry. Council McCarthy?
My question was whether we could have sent it back to Greg's people. It has been vetted by them. I did hear from a lot of the developers today that they were going to send emails. I checked with the clerk prior to the meeting. None of those came. Mr. McCarthy was the only one that spoke. I'm going to agree with Councilor Pat that we move forward. They can get together as a group and try to create another change. I would have preferred that they had got their input in to the planning department ahead of time, but I think the horse is already out of the barn here. So that's my thoughts on that.
Thank you, John. Councilor Memhard?
I'd just like to follow up on Councilor Holmgren's lead, that I think this has been very well vetted and deeply looked into. It is a complicated subject and it could be an ongoing work in progress, but I think at this point, we really should be in a position prepared to vote to proceed with it tonight. Thank you.
Thank you, Scott. Councilor Cox, do you want to proceed with your motion, or would you like to withdraw it? You're on mute. I can't hear you. Oh, there you go.
Sorry. I'm going to proceed because if it gets voted down, I still feel like I'm doing the right thing with asking for the delay. It's not going to hurt anybody or anything to delay. I mean, it's nice that Councilor McCarthy spoke to them and he was checking to see if there were letters that I didn't know. Had I known that, I probably wouldn't have made the motion, but I'm still going to go ahead and go forward with my motion.
Okay. All right, so the motion has been made and seconded to postpone, to continue the public hearing until the June, March 23rd.
I wish
City
it was
Council
June.
meeting. I know, right? All right, so I'll call for the roll call. On a continuance, Councilor Memhard?
No.
Councilor Nolan?
No.
Councilor O'Hara?
Yes.
Councilor Pett?
No.
All right, I don't know if we're on like a 30-second delay, Barry. Councilor Cox?
Yes.
Councilor Gilman?
No.
Councilor Holmgren?
No.
Councilor LeBlanc? No. And Councilor McCarthy?
No.
All right, so a motion fails on a roll call vote of 2 in favor, 7 opposed. So motion fails. All right, so we are still in the councilor question phase. Do we have any more councilor questions before we close the public hearing and send it to committee? Well, ask for the committee report. All right, seeing none, I will close the public hearing and call for Councilor Gilman to give the committee report, please.
Thank you, councilors. On a motion by Council Holgram, seconded by Council Pett, the Planning and Development Committee voted by roll call, 3 in favor, 0 opposed, to recommend that the City Council accept the proposed amendments to the Gloucester zoning ordinance, section 5.11, exclusionary housing requirements, as is included in the Planning Board memo dated February 24th, 2021 to the City Council and attached hereto by incorporation in reference. The main revisions include lowering the project threshold of applicability from the current 8 units to 6 units, comma, providing clear definition of the number of units to be provided based on project size, comma, providing an in lieu payment option for smaller projects, and providing an incentive to create units available to lower income households. These revisions are accompanied by an expansion of defined terms to make it clear what the ordinances require and what an applicant needs to consider in project development. And I so move.
Second.
All right, been moved by Councilor Gilman, seconded by Councilor Holmgren. Any discussion?
So if I may, just do my brief narrative.
Go right ahead.
So, the matters that we discussed at P&D and were repeated today by Greg Catamatori as recommended by the Planning Board is, first of all, the creation of an incentive to build units at 60%. And as a result, it addresses the real need at a lower AMI. The requirement that by and large, the actual units will be built on site, which will increase affordable units and new developments rather than income segregated neighborhoods. An in lieu payment was required that was determined by economic hardship in the past, and this new proposal is elected by the applicant with a payment schedule, and this in lieu payment option is offered for smaller projects. And in general, it provides an incentive to create units affordable to lower income households. So I hope that councilors hear this, and it also was very evident that this has been a long process. There's been a lot of thought from experts and people very involved with this affordable housing and are passionate about it. So I'm happy that we're able to make this motion and consider it tonight. So thank you, councilors. Thank you, P&D as well.
All right. Thank you, Council. Any other discussion? Councilor Holmgren, I'm sorry.
Just a small addition. We're adopting the draft as amended by the Planning Board dated February 18th, 2021. Thank you.
All right, any other councilor discussion? All right, motion's been moved and seconded. I will call for the roll call. Councilor Memhard.
Yes.
Councilor Nolan.
Yes.
Councilor O'Hara.
Yes.
Councilor Pat.
Yes.
Councilor Cox.
Yes.
Councilor Gilman.
Yes.
Councilor Holmgren.
Yes.
Councilor LeBlanc, yes. And Councilor McCarthy.
Yes.
Motion passes on a roll call vote of 9 in favor, 0 opposed.
Mr. President, I would like to move to reconsider the vote.
Second.
Second.
It's been moved and seconded. All right. So everybody is aware of reconsider. So Councilor Memhard.
No.
Councilor Nolan.
No.
Counselor O'Hara,
No.
Counselor Pat,
No.
Counselor Cox,
No.
Counselor Gilman,
No.
Counselor Holmgren,
No.
Counselor LeBlanc, no, and Counselor McCarthy.
No.
All right, motion to reconsider fails on a roll call vote of 0 in favor, 9 opposed. All right, good job, counselors. Nobody said we had a tough job, I mean, an easy job up here. This is tough, and Greg, thank you for, walking us through this, and you deserve every
It's-
minute of your vacation.
I would just say it's no easy task, and I truly take to heart all of the input that we've received. It's something that we have to track and monitor very closely, because Chris and the folks that he mentioned, among others, are really the partners that are going to be part of the solution to this. Again, I don't know that we'll ever quite get there because of what we're up against. But I really appreciate your thoughtfulness. As I think I mentioned, or maybe I haven't mentioned yet, there have been changes at the state level, specifically related to adopting ordinances in cities and towns. It's always great to walk out with a unanimous vote, and I hope that we continue to all be on the same page as we move forward with other proposed amendments.
All right, Greg, thank you. Great job. Good job to
Have a
you
good
and the
night.
team. Appreciate it. You too.
Counselor, can I move that we take a 3-minute recess so we
Yeah.
can use the restrooms and
Sure,
not
we
have to
can-
all black our faces out and
Yeah, we can take a 3-minute recess. We still got quite a little bit ahead of us. We've got a few, we got the CPC funding, so we've got a little bit before us still. So, yeah, we'll recess for 3 minutes.
thank you.
All right, we're just waiting for Melissa. Now it's perfect timing though, Val, because my legs were getting cramped sitting here.
I couldn't wait any longer.
I don't blame you.
And I see 45 attendees still. It's like, this is going to be a long meeting.
Yeah, we still got a little bit of time before us.
I was
All
hoping that Melissa would have put up another picture of a fine boat or something behind her. She must have put all her art.
All right, we're all back together. So we are back in session. Our pause is over. So Madam Clerk, can we have the next order of business, please?
The next order of business is public hearing 2021-004, the recommendations of the Community Preservation Committee, round 11, FY20.
Thank you. All right, so I will, hold on one second, Joanne. We have Pam Toby. Should we promote her to panelist? Is she on the board for this?
She's on the CPA committee, yes.
All right, let me see if I saw her earlier.
And so is Matt Lombard.
All right, let me see if I can see.
They have their hand raised. Pamela has her hand raised.
All right, cool. Let me see. Panelist and.
Thank you. And Joanne, am I all set to share my screen?
Yes, you are.
Thank
All
you.
right. And who else should we promote?
Matt Lombard.
Matt, let me see if I can get Matt down there. All right. Oop. Hold on 1 second. Hold on before we get started. I gotta promote Matt. All right. All right. So we got everybody that needs to be on the panel. Okay. So I will open the public hearing and ask if there is anybody that would like to speak in favor. All right, so so who would like to go first? Pam, would that be you?
Yeah, I'll
Okay.
start it off.
Go ahead. Thank you.
So first of all, thank you for having me. I know you guys have had a long meeting, so I'll be quick as possible. First, I just want to thank the other members of the committee, the Community Preservation Committee. And I want to give a big thanks to Jamie Corliss, our staff person. She has been amazing and she does so much hard work. So today we'll be going over 4 projects. Jamie, do you want to go to the next one? Yep. So today we will be talking about the Cape Ann Museum, stabilization of the Babson Alling House, the City of Gloucester, DPW, Fitzhenry Lane roof replacement and renovations, Ocean Alliance paint factory seawall stabilization, and the North Shore YMCA affordable housing at 71 Middle Street. So this is just a quick budget overview of what current balances are as of December 1st, 2020, and where things would land if after the recommendations were made. I'm sure you all know this, but 10% is allocated to each category, and then everything else goes into general reserves. So up first, we have the Cape Ann Museum stabilization of the Babson Alling House. As you guys know, it's kind of one of the first things you see when you go around the Rotary. So it's exciting to kind of have an investment in something like that. So this project would include repairs to trim and clapboards, stabilization and restoration of windows, and manufacture and installation of exterior storm windows. The total cost of the project is estimated to be $247,350. The amount requested from CPA is $125,000, and that is the amount we recommend. And it's eligible as a historic preservation project. So I'm happy to answer any questions, but I'm going to turn it over or invite the Cape Ann Museum to kind of present on it.
Hi, I'm Martha Oakes, and I'm the curator of the museum and responsible for this project. And thank you for recommending our proposal. I'm sure you're all familiar with this house. The museum has owned it since February of 2019, and it's part of the larger site that includes the White Ellery House, the little shingled barn between the Babson Alling House and the White Ellery House, and then about 3 acres of land behind the two structures where we've just recently constructed our new collection center. The rest of the land on the site has been left open for public use and for use by the museum. And we're now turning our attention towards stabilizing the outside of the Babson Alling House. In the last year, we've begun work. We've done stabilization work to the central chimney and rebuilt the chimney from the roof line up. And we've also done restoration work on the roof of the building. And if you've driven by, there's a very obvious and evident preservation efforts that we've done. Inside the building, we have also done some structural work, including repairs to some of the floor joists, especially around the central chimney, repair to what appears to be the original plaster ceiling in one of the first floor rooms, and also repairs to the central staircase. And since it is a historic building, all of these repairs seem to cost much more than they would in an average modern home. So it's a project that we're pleased to be moving ahead with. And we're hoping to get CPA support to begin the next phase later this year, working on the facade of the building. It has a whole hodgepodge of window sashes, including some that appear to be 1990 on the right-hand side of the building, which we need to replace with more sympathetic sashes. The front doorway to the house has been altered quite a bit. And a lot of the trim around the house, as well as the clapboards, is in very poor condition. There's been loss of some of the trim that we need to correct and replace. And also make the building overall much more watertight so that we continue to preserve it. And as I said, it'll be part of our operations there at what we're calling the Cape Ann Museum Green. It's a property that we share with the public free of charge. It's been, as I said before, extraordinarily helpful this past year because it has the outside component. And it's a project that we're very proud to be moving ahead with. So if you have any questions, I'd be happy to answer them.
Any councilor questions? Okay, seeing none. Go ahead, Martha, if you want to proceed.
So next up, we have the Gloucester DPW Fitzhenry Lane roof repair. They will utilize the funds to replace the roof of the Fitzhenry Lane house. This will include the replacement of asphalt shingles with slate shingles that are in keeping with the building's original fabric. The total estimated cost is $140,000, and the amount requested from the CPA is $120,000, and the committee recommends that amount. Again, this is eligible as a historic preservation project. I'm happy to answer any questions, but I figured I should turn it over to the DPW.
All right. So who do we have from the DPW that's here this evening? I don't see anybody.
Jamie, is Mike Hales, is he joining?
I don't see Mike.
Then if anyone has any questions, I'm happy to answer them.
Hold on, let me see if I can see Mike on a call. I don't see him. And that's okay. Yeah, so I mean, basically it's self-explanatory what you just said.
Yeah, Steve, that's what it is. It's just, the bathrooms on the first floor, if you know, the bathrooms are historic and some of them were not handicap, and it needs all new floorings. The roof needs to be updated, and we're asking for $140,000 total cost, but $120,000 will come from the CPA.
Yeah, like I said, it's basically self-explanatory.
And exactly, but the reason why someone's saying, well, $120,000 for a bathroom and a roof, because you don't remember the house is old and you have to comply with the historic part for the roof and get everything that was done properly.
Okay, thank you, Mayor. All right, Pam, if you want to proceed.
You got it. So up next is Ocean Alliance, the Paint Factory seawall restoration. We all know that the Paint Factory is an iconic harbor landmark and we want to preserve it. They will utilize the funds to repair and restore the seawall on the easterly wall of the gravel parking area at the paint factory. The total estimated cost of the project is $113,898. The amount they're requesting from CPA is $68,623, and that is the amount we're recommending. And again, it's a historic preservation project. I don't know if someone from Ocean Alliance is on, but if they have anything to add.
Let me see if there's if anybody's on from Ocean Alliance.
I see Alicia.
What's that, Sean?
Alicia.
Oh, yeah, there we go. All right. Let me see. Alicia, let me see. Gotta get up to you. All right. There we go. Alicia, you there? Oop. All right, Alicia, can you hear me? There you go.
Hi, yeah, I'm on now. Thank you.
You're welcome.
Hi, so thank you, everyone. Long night. So thank you for doing the work that you guys do. It's very much appreciated. So yes, this is the seawall restoration. So this is to the left of our parking lot, and kind of next to the space where the former warehouse buildings were. And this was a riprap seawall that was put in place with infill from the parking lot area in 1957. And so we want to replace that eroded riprap. We want to prevent it from continuing to erode, especially since we don't know what that fill contains. And we're going to put up a concrete seawall in that area to make sure it can withstand flood levels and further erosion from wave action.
Okay, thank you. Then we have one more.
Yes, one more. So the last one is North Shore YMCA's 71 Middle Street Affordable Housing, which you guys quickly touched on earlier. They will utilize the funds to develop 40 units of affordable rental units for seniors. All units will be restricted to seniors with income no greater than 60% of the area median income. 10% will be restricted to 30% or below. The total estimated cost is $16,672,165. I had to practice that number a couple times. It's a tough one. And the amount requested from CPA is $200,000, and that is the amount we're recommending. And this one is eligible as an affordable housing project. And I believe someone from the Y is on.
Yeah, I just promoted Chris, so I'm not
Okay.
sure if, there we are.
Yes, thank you so much, Counselor. This is about affordable housing. I don't know if you guys are really aware of what affordable housing is. So I figured maybe you had a little bit of time to think about it tonight. Thank you guys very much. We are presenting Middle Street housing. By the way, we did have a number of meetings to talk about what really affordable housing is for about the last 3 years. So this is important, and I think it is amazing what you guys are considering and have done. So thank you. Middle Street housing. We are putting together 44 units of affordable housing for seniors. If you flip to the next slide, you'll see that location right there. So it's currently still slated to be at what you see in front of you, which is the current Cape Ann YMCA. So obviously, I hope everyone sees that the new Y is just about ready at our 7 Gloucester Crossing Road. Once that is done, we will be moving over all of our programming there in June. And at that point, that building will be ready to be used for affordable housing when we are approved. And so if we move to the next slide. The benefits are much. So obviously, this is going to take the vacant building and bring it back to a vibrancy in the downtown area. It'll provide 44 seniors with quality affordable housing. As you've heard about tonight in detail, it is really affordable. It'll be in the 30s, 50s, and 60s. So I believe it's 9 and 9, the remainder being at 60. And it really does support the goals of the city that you've heard greatly about tonight. It offers a robust menu of supportive services. It'll have a resident service community coordinator. It'll have a great outdoor space. And we'll make sure that there is transportation from there to our brand new YMCA. Next slide, please. So this is, it's slated at over $16 to $17 million. That is the construction cost. There is additional costs for the project that bring the project cost really up into an investment into the community of over $20 million. For people who know the DHCD process, it is important to try to show as much community support. It helps to bring the project up in the queue and get a quicker approval. It is never guaranteed, but if there is not community support at a level that is material, it does score low and it does take possibly 2 or 3 rounds. The more investment, the more people elevate the project capabilities. And again, the sooner we get it done, the sooner we can move on and use that building for what it should be. Next slide, please. And we're going to help all of our seniors in Gloucester, and that is what we have slated to do. Thank you.
All right, awesome. Thank you, Chris. Councilor Pat.
Yes, just if Chris, if you could go back to the first slide on this project.
Sure.
I just wanted to see if we could go and correct something. If I didn't miss it, I thought I saw the original first slide said 40 units, and I want to make sure you get that corrected. If I saw it correctly, to get it corrected for the for the record when you put it in.
Sure.
Yep, that was my mistake on my slide.
Okay, no problem.
Thank you. I'll make sure that's corrected.
Yep, that should be 44 units. And
thank you.
Yes, and I believe it's 9 units. I'm sorry, 9 units at 30%, 9 units at 50%, and then the remainder at 60%. So it's not just 30 and 60.
Awesome. All right, thank you, Chris. Good catch, Barry. Appreciate that. Just to, just to be on the safe side. All right, Pam, we'll turn it back over to you. Is there anything else?
No, that's it. Thank you again for having us. I did want to make a quick plug that our next round of eligibility forms are due this Friday for the next round of funding. So just wanted to throw that out there. But thank you for having us. Thank you for letting us present.
Awesome job. Thank you.
Thanks, guys.
Do we have any councilor questions before we? Oh, actually, hold on 1 second, Belle. So we're in the public hearing. Do we have anybody else that would like to speak in support? If you are calling in, *9. If you are on your laptop device, you can raise your hand. Is there anybody that is in opposition? Okay, seeing none. Madam Clerk, are there any communications?
There are none.
All right, and now we're at councilor questions. Councilor Gilman.
Thank you, Counselor. So I have a question that possibly the mayor might be able to answer through the chair. On the Fitz Henry Lane House, the roof renovation replacement project, I'm interested to know if organizations like Sale GHS will still be allowed to use that facility if they need to. That was used to be the spot where Sale GHS was located. Probably, I want to say my son was in O'Malley, so it was probably 6 or 7 years ago. But it really became a hub for them with restrooms and etc. So just in terms of a publicly funded location, I was just interested to find out if that would still be the case.
Well, thank you. First of all, pre-COVID, they've been using it. Gloucester H Sale, actually, we had to make them become part of the school because Gloucester, they were thinking it was part of the high school and it wasn't. It was actually a private entity. And they were getting grants thinking that it was a school-based program. So a couple of years ago, actually probably around 2015, I think when I was interim, we made them part of the school. And so they are using, they're sharing the building. and they have to actually maintain it. Everyone who's been sharing the building have been maintaining and cleaning it. Unfortunately, it's old and it needs to be updated, and still the basement is where they store some of their gear and change, and the restrooms are still being shared with the Adventure.
Great. Thanks, Mayor. You answered my question.
Thank you, Val. Any other councilor questions? All right, seeing none, I will close the public hearing. And we have a couple of committee recommendations. So Councilor Gilman. Oh, I'm sorry. Councilor Cox.
We actually have 4.
Yep.
Let's see. Budget and Finance voted unanimously to recommend the City Council appropriate up to $125,000 from the Community Preservation Act Fund as recommended by the Community Preservation Committee to the Cape Ann Museum for the purpose to preserve and rehabilitate the stabilization of the Babson Alling House in order to restore an historic resource. The appropriation will be allocated to the historic preservation category and funded from unrestricted reserves in Fund 4500. The project will be tracked in the Community Preservation Fund, Historic Preservation Projects Fund 4745, and I so move.
Second.
Motion's been moved by Councilor Cox, seconded by Councilor Memhard. Any discussion? Okay, seeing none, I will call for the roll call. Councilor Memhard.
Full disclosure, my wife is the curator at the Cape Ann Museum, but I have no personal financial benefit from this project, and I support it, yes.
Thank you, Scott. Councilor Nolan. Sean.
No, he's just muted.
Sorry about that. I do support this, and I do want to thank Councilor Cox for the pictures from the site visit that I couldn't make it. They were wonderful, and it's a great program.
Councilor O'Hara.
Yes.
Councilor Pat.
Yes.
Councilor Cox.
Yes.
Councilor Gilman.
Yes.
Councilor Holmgren.
Yes, absolutely.
Councilor LeBlanc. Spending money in Ward 3. Yes. And Councilor McCarthy.
Yes.
All right, motion passes on a roll call vote of 9 in favor, 0 opposed. Councilor
Budget
Cox.
and Finance recommends the City Council appropriate $120,000 from the Community Preservation Act Fund as recommended by the Community Preservation Committee to the City of Gloucester for the purpose to preserve and rehabilitate the Fitzhenry Lane House roof replacement in order to restore a historic resource. The appropriation will be allocated to the Historic Preservation category.
I guess.
Somebody have something to say?
I think it was just your feedback. I think it was somebody's microphone reverbing what you were saying.
Okay. The appropriation will be allocated to the Historic Preservation category and funded from unrestricted reserves in Fund 4500. The project will be tracked in the Community Preservation Fund, Historic Preservation Capital Projects Fund 5810, and I so move.
Second.
Been moved by Councilor Cox, seconded by Councilor Memhard. Any discussion? Obviously not. We've already had it through CPC. All right. Call for the roll. Councilor Memhard.
Yes.
Councilor Nolan.
Yes.
Councilor O'Hara.
Yes.
Councilor Pat.
Yes.
Councilor Cox.
Yes.
Councilor Gilman.
Yes.
Councilor Holmgren.
Yes.
Councilor LeBlanc. Yes. And Councilor McCarthy.
Yes.
Motion passes on a roll call vote of 9 in favor, 0 opposed. Councilor
Before I
Cox.
move on to the next one, I want to declare that while my employer has been doing work on this property, we will not be doing this work. So there's no monetary involvement for myself or my employer. So I will be voting on this tonight.
Thank you, Councilor.
Budget and Finance voted unanimously to recommend the City Council appropriate up to $68,623 from the Community Preservation Act funds as recommended by the Community Preservation Committee to Ocean Alliance for the purpose to preserve and rehabilitate the Ocean Alliance Paint Factory Seawall Stabilization Project in order to restore a historic resource. The appropriation will be allocated to the historic preservation category and funded from unrestricted reserve in Fund 4500. The project will be tracked in the Community Preservation Fund, Historic Preservation Fund 4746, and I so move.
Second.
Been moved by Councilor Cox, seconded by Councilor Memhard. I have a question on this one, Councilor. So
Yep.
the motion says up to 68,623. What happens if they don't, where does the money go? Does it go back to the CPC if they don't use that entire amount?
Correct.
Okay, just making sure. Okay, sounds good. Any other discussion? All right, seeing none. Councilor Memhard? Nope. Scott, you there? Roll call? I think he.
Yes.
Oh, there we are. Councilor Nolan? You're on mute, Sean.
Absolutely.
There you go. Councilor O'Hara?
Yes.
Councilor Pat? Did we lose Barry? Barry, you with us? I'll circle back
Yes.
to Barry. Oh, there we go.
Yes.
Councilor Cox?
Yes.
Councilor Gilman?
Yes.
Councilor Holmgren?
Yes, I'm very happy to support this.
Councilor LeBlanc, yes, and Councilor McCarthy.
Yes.
Motion passes on a roll call vote of 9 in favor, 0 opposed. Councilor Cox.
Budget and Finance voted unanimously to recommend the City Council appropriate up to $200,000 from the Community Preservation Act Fund as recommended by the Community Preservation Committee to the North Shore YMCA for the purpose of a new senior affordable housing development located at 71 Middle Street. The appropriation will be allocated to the community housing category and funded from the Community Housing Reserve Fund 4530. The project will be tracked in the Community Preservation Fund, Community Housing Projects Fund 4905, and I so move.
Second.
Scott?
Second.
There you go. It's been moved.
Second.
Moved and seconded. Any other discussion? Yeah,
No.
seeing none. Councilor Memhard.
Second.
Roll call. Councilor Memhard.
Yes.
Councilor Nolan.
Yes.
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 Councilor O'Hara.
Yes.
Hold on. Councilor Pat.
Yes.
Councilor Cox.
Yes.
Councilor Gilman.
Yes.
Councilor Holmgren.
Aye.
Councilor LeBlanc. Yes. And Councilor McCarthy.
Yes.
All right, motion passes on a roll call vote of 9 in favor, 0 opposed. All right, so that's it for the community preservation, correct? All right,
Correct.
kudos to your team, Pam. You guys did a great job. Matt, everybody, we appreciate everything you've done. We're looking forward to the next round, and the applications are due by Friday, correct? For the
Yep,
next round?
eligibility forms are due on Friday. Yep.
All right, so for those people that are listening that aren't familiar, where do you find these applications? Are they online?
Yep. So they're on the community preservation website, on the city's website.
Okay, great. So if anybody knows of anything in the city that could use a little bit of community preservation, please let them know that there are funds available. All right. Awesome job, everyone. Thank you, guys. Appreciate it.
Thanks, guys.
Madam Clerk, next order of business, please.
Next order of business is public hearing 2020-010, special city council permit 2020-002, Essex Avenue, number 99A, map 216, lot 126, Gloucester zoning ordinance, section 3.1.6, parentheses B, building heights in excess of 35 feet, Section 2.3.4, parentheses 13, marine-related service, storage, or repair, limited primarily in the MI district to commercial fishing vessels. Section 5.5, low land requirements, Section 5.5.2, and Section 5.5.3 in the EB district.
Madam Clerk, so the applicant has asked to have this withdrawn. I will hand it over to Councilor Gilman for a motion.
I move to withdraw PH 2020-10, Special Council Permit 2020-002, Essex Ave, number 99A, map 216, lot 126, GZO, section. Can I just say et cetera? Do I need to read the whole thing?
I would read the whole thing just to be.
Okay, GZO, section 3.1.6B, building heights in excess of 35 feet, section 2.3.4, number 13, marine-related service, storage, or repair, limited primarily in the MI district to commercial fishing vessels. Section 5.5, low land requirements, section 5.5.2, and section 5.5.3 in the EB district. And I so move.
Second.
Is that without prejudice?
To be withdrawn without prejudice. Thank you, Councilor Nolan.
Second.
All right, so it's been withdrawn without prejudice by Councilor, moved by Councilor Gilman, seconded by Councilor Holmgren. All right, any other discussion, Councilor Gilman? Saying
No,
none?
thank.
Okay. All right, so I will offer for, call for the roll call. Councilor Memhard,
Yes.
Councilor Nolan,
Yes.
Councilor O'Hara,
Yes.
Councilor Pat,
Yes.
Councilor Cox,
Yes.
Councilor Gilman,
Yes.
Councilor Holmgren,
Yes.
Councilor LeBlanc, yes, and Councilor McCarthy.
Yes.
Motion to withdraw without prejudice has been passed on a roll call vote of 9 in favor, 0 opposed. All right. Madam Clerk, next order of business, please.
Are you going to do the oral communications before a request to the mayor?
Yes, and then jump back up to oral communications. All right, so before we start, I would just want to set up a couple of rules. You know, we have the firing range before us Monday, this coming Monday at Ordinance Administration. So I don't want to say we can't listen to you guys, but I'm going to try to limit the firing range to a minute, please. You know, we've heard the emails, we've heard oral communications over and over again. We understand. So if you're going to speak about the firing range, please limit it to a minute. So I'm going to open up oral communications, but before I do, the public shall have the opportunity at every regularly scheduled meeting to be heard under oral communications on matters not appearing on the agenda. Oral communications shall allow any resident who has a request or complaint of any nature relative to city business to appear before the council, state their problem without debate, and the matter shall be referred to the proper agency through the office of the mayor. The resident will be notified within a 2-week period prior to relative to disposition of same, and a copy shall be forwarded to the city council. Persons speaking under oral communications shall be limited to 3 minutes each, and the council president shall not allow complaints as to individual performance. So once again, like I said, we're going to limit the firing range to a minute because it is before us. We will have a public hearing on that in the future, and you will be able to express your concerns on the firing range at the public hearing. So first up, we have Mary Ann. Mary Ann, can you hear me?
I can, thank you.
Yep. Oh, name and address for the record, please.
Yes, Mary Ann Albert Boucher, 93 Mount Pleasant Avenue.
Thank you.
East Gloucester. And as an East Gloucester resident, I've waited a long time tonight to say this. I think it's extremely important. This past Sunday, while heading out of town with my husband, I approached the Route 128 and Eastern Avenue lights at 12:45 p.m. And upon arrival, there was an accident that had just occurred and the squad had just arrived. At 5:45 p.m. on the same evening, this past Sunday, another accident occurred. Just 3 weeks ago, the Jaws of Life was used at the same site. We have 200 units for Halyard coming, the YMCA, 44 senior units, 30 Harbor Village units, and continuous development, as we have all listened to tonight, taking place in and around this area. This is only March. What will this area be like once all of the new development is in and under operation? What will the area be like once warm weather arrives? I ask you to please, please take this area into consideration with all of the proposed development that is about to occur in and around Route 128, 127, Webster Street especially. I don't want to see someone get killed. And that is why I'm here. That is why I've waited so long to speak tonight. It's critical. And I really wish that, and I hope that my city council, our city council, please looks into this. Please look into this before we have someone killed. Thank you.
Thank you, Mary Ann. All right, up next is Grant. Grant, can you hear me?
Yes, I can, Steve. Can you hear me all right?
Yes, name and address for the record, please.
Sure. Grant Clark, 279 Concord Street. This does concern the firing range, so I'll be brief and I'll put any additional comments in an email to the council. But
thank you.
In light of the ONA meeting coming up, I wanted to make the full council aware of an issue that we raised at the last ONA, which we believe may streamline this process a bit. On the advice of council retained by the residents, we've been advised that the Haskell Reservoir land is so-called Article 97 land under the Mass Constitution. And as such, it cannot be repurposed for a firing range without compliance with the Article 97 requirements. We understand that hasn't been done and that's being looked at by city attorney presently.
No, I'll stay here and grab one.
Counselor,
Sorry about that.
just
hold
a
on one
point of
second.
order, that is a matter that needs to be taken up on Monday, because that was the matter that was brought up at the last meeting.
Right. So Grant, we are looking into this. We understand. But go ahead, proceed. You got a little bit of time left. Go ahead.
Yeah, I would just two points. We understand the city is looking at this and we encourage that. We would request the city refrain from using the land as a range until the legality has been resolved one way or another. And we wanted you all to be aware that we will be submitting within just a few days a legal memorandum of opinion from council on this point, and we will share it with all of you. I just wanted to see if we could avoid a potential train wreck down the road. That's all. Thank you.
Thank you, Grant. Appreciate it. All right. Up next, we have a caller. Last four digits 9894. Can you hear me?
Yes. Hello.
All right.
Can you hear me?
Yes. Name and address for the record, please.
Okay, my name is Meg Herman. I live at 17 Walker Street in West Gloucester, and I'm going to speak about the firing range. This is my first time sort of speaking up on this. I'm also representing my husband, Bruce Herman, and my daughter and her husband, Sarah and Peter Herman, Helpful, who live at the same address. We live in a spot where we hear the sound of the shooting range very distinctly on our property. And, you know, as a senior who has been locked up for the last year, the thought of when we are able to open our windows and go outside, that there's going to be 50 days of shooting in warm weather, and we can't be expected to go inside and close our windows to get away from it. You know, we haven't seen our family and our friends And soon the weather is going to allow us to be outside with people. And there'll be 50 days I cannot have family and friends and neighbors up here visiting because it's just an obtrusive, terrible sound. It's very distressing. And we should not have to go inside and close our windows. And have you thought about doing this in like early winter or late winter instead of the months when we have our windows open and we want to be outside? And I'm also feeling that the amount of days that you need just seems excessive for what I think is a relatively small police department. And so it makes me wonder if you are providing all this additional time for other things such as recreational shooting or police from other towns to use the range, or for our officers to get certified with more lethal weapons that are not actually required for this precinct. I mean, I hope that's not the case. My mind is kind of racing here. And also, as a former realtor, this shooting range definitely affects our home values. We are, I can't imagine showing a house to a buyer and saying, oh, and by the way, 50 days out of the year, you're going to have to listen to shooting. That's house prices will drop. So we just want to shut this thing down. It's just got to be shut down, because you would not want to live here. Honestly, none of you would want to live here if you had to listen to this when you want to be outside gardening and having your friends over, especially when you've been locked up for a year. So please shut this thing down. Thank you for listening to me.
Thank you. All right. Dennis, can you hear me?
I can hear you.
Yep. Name and address for the record, please.
Dennis McGurk at 283 Concord Street. Thanks for your time. It's late. But very briefly, regarding the firing range, the critical and very specific legal problem with having the area repurposed will be resolved somehow. But the issues of the environmental destruction, the neighborhood destruction, and the overall safety won't ever be resolved. Outdoor firing ranges are a problem for most towns in their affected neighborhoods. So maybe this common problem creates an opportunity. Maybe we should be thinking long-term without Band-Aid approaches. Until indoor facilities are built, the problems are going to persist. Maybe we should consider partnering with other North Shore towns, they got the same problem, and build an indoor facility. Thanks a lot. Have a good night.
Thank you, Dennis. Appreciate that. All right. Up next, we have Judy. Judy, can you hear me? Judy? All right, I'm gonna leave Judy here.
Okay, I'm here.
All right.
Sorry, this is my first go. Judy Rose, 17 Landing Road. I am wanting to talk about the firing range as well. It says that you guys are going to have the DPW implement a plan for the management of these bullets as suggested by the US EPA. And my concern with that, honestly, is going back to the management plan the city of Gloucester had for the beaches, and nobody was following up with that, taking care of the piles of trash. And my concern is that this same exact thing is going to happen, that nobody is going to take care of all of that lead poisoning that's going to be there. And, and I reiterate what other people have said too, the noise is a huge issue, the effects on property value being negative, the open space area that all of us in West Gloucester have enjoyed our entire lives. And I'm absolutely against having this firing range in our backyard. So I hope that you'll reconsider it. I agree with the last caller that said, it should be indoors.
Thank you, Judy. All right. Up next, we have Tom. Tom, can you hear me?
Yes, I just unmuted. Am I there?
Yep, name and address for the record, please.
Oh, thank you. Tom Jurgens, number 5 Overlook Avenue. Good evening. I'm quite grateful for the opportunity to be heard on this. This being the shooting range as well. I think it's pretty accurate to say the current proposition is to allow shooting, if you average it out, more than 1 day out of every 3 during the best weather we get. Best weather, anything but winter. Windows are open. There's gardening, all sorts of outdoor putting around, lunches outside. We're happier. We're getting compensated for enduring winter. These are not little things. These are the things we eagerly anticipate and live for. These are big things. In my humble opinion, all that shooting will profoundly degrade those times and entire neighborhoods. So there's some questions. A whole lot of people will wish they could live somewhere else. How many will be compelled to sell? And to sell at what discount compared to sales of properties far enough away to render the noise insignificant? And how remote really is the possibility of a class action against the city based on degraded property values? This is a dead horse almost. There's been much ado about the appropriateness or inappropriateness of the public meetings. I'm too new to this to know the history well enough to have a strong opinion on that. Let's just say everything's perfectly legal. Still, with all due respect, given the enormity of the issue and the fact that many in the affected neighborhoods first learned about all this after the fact and only via the anti-range flyers in their mailboxes, I submit the meetings were also ineffective, or I dare say not inclusive enough. So to end, I think too few of us in West Gloucester were aware enough, soon enough, to seize the opportunity to nip this thing in the bud. And I respectfully request the city to please rescind the ordinance, or at least reboot it and give us a better chance to be heard and defeat it. Thank you all for giving me this time.
Thank you, Tom. All right, up next we have Lorraine. Lorraine, can you hear me?
Yeah, hi.
Hi, name and address for the record, please.
I just want to, Lorraine Cicchetti, 18 Lincoln Street. I just want to repeat for the record that I'm deeply opposed to the firing range for all of the reasons that have been stated and restated by other concerned citizens. The opening of this range was ill-conceived on so many levels, and the ordinance needs to be rescinded. It's also become increasingly clear that there are other viable alternatives to this issue, which need to be fully explored so that police training requirements can be met. A firing range at the present location, in my view, is really unacceptable. Thank you for listening.
Thank you. Up next, Robin. Robin, can you hear me?
I can hear you.
Yep, name and address for the record, please.
Robin Hosking, 24th Lane, Gloucester.
Thank you.
I just wanted to follow up on other people's mentioning that with the windows open, that you can hear the gunshots. I live half a mile away. It doesn't take the windows being open to hear the gunshots. You cannot escape the gunshots without leaving your house and going far away. So closing the windows does not work. We can all attest to that at my house, the three of us. The other thing I wanted to follow up on was the facts that Chief Conley put out. I don't really understand why it would cost over $47,000 to train at Fort Devens, because I got in touch with someone at Fort Devens. It is $250 a day. So times 15, you're talking what, $3,000, and I can't think of it right now, but I think I added up like $7,000 for the whole season. So that fact is clearly not true. As far as commuting there, don't see anything wrong with carpooling. I don't think it would cost 40 grand for that. Also, him saying that that's 47 decibels from Forest Lane, that is clearly inaccurate. Like I stated before, that's ambient household noise, which no one would be even noticing. It's something like, what is it, Chris? It's like 180 or something, or 130, or like it's
At the source would be about 110 here.
Okay, so I don't know if you heard that. It's about 110 where we are, but it's quite high. Anyway, so thank you very much.
Thank you. All right, Steve, can you hear me? Steven? I'll leave him here for a second. I'll go on to the next person. All right, we have a caller on a Samsung. Hello, caller, can you hear me?
Yes, Steve Noel.
All right, hold on one second. I got two of you up here. Steve, hold on one second. We got one person in front of you who we were holding off on you, so we've got a
Okay.
caller on the Samsung. Hold on one second, bud.
No problem.
Samsung caller, name and address, please.
David Height, 3 LaRose Avenue, Gloucester, Mass.
Thank you, go ahead.
Yeah, the noise ordinance over here is all over 100 decibels in West Gloucester. We can't even sit with the windows open on our back porch for the summertime when you guys are shooting. It's lowering the property values, and what the lid is doing to the dam and the pollution from it. We don't know what it's gonna do to the future kids. So that's what I have to say.
All right, thank you. All right, Steve, back to you, bud. Can you hear me?
Yeah, I sure can. Thank you, Steve.
Name and address for the record.
Sure, Steve Noel, 567 Essex Avenue, Gloucester. Yep, and I too live about a half a mile away, and you can absolutely hear the shooting very clearly with the windows closed. That was just one thing. The other thing, I think after last week, all of this is kind of resurfaced from 2009 based on convenience. And I think we all heard that last week when we heard Chief Connolly in scheduling and the time to get to Devon's. I don't know about you, but most people have to travel for their job, and to inconvenience officers for a couple times a year to go to Fort Devens, all of this could be, eliminated. I mean, there's a reason why they have shooting ranges on forts and military bases and not in residential neighborhoods where people are trying to enjoy the beauty of the environment. On paper, you look at this and it's pretty unfathomable that we're having this conversation, putting a firing range in an area designated for public use. And that's all I want to say, and looking forward to next week. Thank you for listening.
Thank you, Steve. All right, up next we have Patty. Patty, can you hear me?
Yes, Steve. Am I on?
Yep, name and address for the record, please.
Hi, thank you. Patty Page, 3 Tidal Cove Way. I attended the MIPA public hearing recently for the school, the veteran school. And I made a request there that there was a 2019 public meeting, and Niche Engineering, Jonathan Soers, I believe, made a presentation. He utilized a animated traffic software, and he did some, I wasn't at the meeting, but he did some kind of software presentation with that. I made the request that we bring that back, that he make that presentation again. I was hoping before the MIPA public comment period ended March 16th. I haven't really heard anything. I guess my question would be to the council and the mayor, what might be the appropriate avenue by which to make a proper request that this presentation can be revisited, resubmitted by Jonathan Soers of Niche Engineering? some of us in the public would like to see that. We weren't able to, and apparently it's not recorded. If that's something you can address, fine. Quickly, that would be nice. If not, even after the public meeting deadline of March 16th, I think it might be appreciated that the community see that. So if someone might get back to me on that, I'd be happy to work on that. Thank you.
Thank you, Patty. All right, is there anybody else for communications? All right. Jean, can you hear me?
Yep,
Name and address for the record, please.
Jean Grobe, 17 Lincoln Street.
Go ahead.
This is about the range again. So we as citizens and taxpayers, and most importantly, voters in Gloucester, support the police department 100%. When things like this happen, people always think you're anti-police. No one is anti-police. We support them 100%. We are so concerned with their training that we are now asking our city leaders to take a step back and put together a well thought out plan with budget details that work for the police department and the community moving forward. I don't understand why this is so difficult. Don't you all agree this is how it should be done? This Band-Aid of an ordinance solves nothing for the department and really only serves to undermine the police department and the community. Listening to these discussions tonight on affordable housing, it really made me sad to think this whole ordinance was passed with like no discussion. And I would love to have seen budget and numbers and alternatives and a really nice community type of engagement to discuss something like this that's so important to a community. So that's all I have to say. Thank you.
All right, well, thank you. And I'm going to respond to that. These ordinance aren't passed without anybody seeing anything. And we don't do these behind closed doors. These are all done in public. These are all put in the newspaper. They're all posted like everything else. Just because people don't, follow these, it doesn't mean that we're doing things behind it. So I'm a little,
Steve, am I muted?
I'm a little bit aggravated that we're being accused of doing these things behind closed doors. So I'm sorry, Gene, but I don't agree with your reasoning here. Band-aids, we don't Band-aid anything. I'm sorry. All right, Madam Clerk, can we have the next order of business, please? Oh, actually, we have one more person for oral communications. Mary Ellen, can you hear me?
I can.
Name and address for the record, please.
23 Concord Street.
Go ahead.
I just want to state my opposition to allowing that rifle range to continue. I think it's a hazard to the community and I believe it's a violation of EPA, and I filed a complaint with the EPA in Washington, and I wasn't sure if that got copied to you all or not.
Did you send an email in, Mary Ellen?
I did. I sent it to my sister, who I thought was they told me they sent it, but I have gone ahead and I'll go ahead and send you a copy as well. I have a copy. I took a copy of it and I'll send it just in case it didn't get to you.
Thank you. And if you send it to our city clerk, she will make sure that we all get a copy of it. So that way you don't have to email every one of us individually. So it makes it a little bit easier.
Oh, okay.
All right.
Okay,
Awesome.
I'll do that. I'm sorry I'm coming late. I hopped off at 9 and I didn't
That's
realize you
okay.
guys were still talking.
It's a long night. I understand. Thank you, Mary Ellen. Appreciate it.
You're welcome.
All right. We have a couple more people. Hillary, can you hear me?
Yeah, this is Eric Holdsworth, Hillary's husband. Can you hear me?
Okay. Name and address for the record, please.
It's Eric Holdsworth, 19R Walker Street.
Go ahead. Thank you.
And thank you all for what you do. And I'm just speaking out in opposition to the firing range, which actually everybody keeps referring it to as a shooting range, which is sort of a misnomer because it's essentially a berm at a trailhead that's very popular with the community. Actual shooting ranges are designed and built with safety in mind and noise mitigation, drainage, lighting, things like that. this is a makeshift sort of operation that seems unsafe ultimately. If there was an accident, would the makeshift nature of this facility become a liability for the city? So I think it's a question that should just be asked, and I'll leave it at that. Thanks.
Thank you. All right, we have Deb. Deb, can you hear me?
Yes, Debbie Holland, 11 Jebbica Lane.
Thank you. Go ahead.
I wanted to follow up on what Jean was saying. I'm sure that there were intense budget and financial analysis done to evaluate this range and analyze the costs of all the alternatives. And I'd like to ask that those be shared with the community. Thank you.
Thank you. All right. Not seeing anybody else for oral communications. Madam Clerk, can we have the next order of business, please?
The next order of business is request to the mayor.
All right, so I will start off with Council Memhard, who didn't get a chance last week. Scott?
Yeah, it's all right. I'm good. Nothing tonight. Thank you, Steve.
Thank you, bud. Councilor Nolan?
All good tonight. You guys did a great job. Thank you all.
Thank you. Councilor O'Hara?
Thank you. All set.
Councilor Pat?
All set this evening. Thank you, everyone, for a long night, and everyone keeping themselves together with a smile for the camera.
All right, Councilor Cox?
I do have one. I think that there is a process in which the lights at Eastern Ave can be on a little bit of a delay. I myself have been in that intersection at the front of the line with a green light and somebody runs the red light. And it happens a lot. So I would like to request that the state put maybe a 2 or 3 second delay on the light change, just to prevent that from trying to mitigate that from happening. So I don't know if that's a home rule petition or if that's just a request through DPW to the state. I'm not sure. So I will look into that.
All right, thank you, Melissa. Let's see.
It's managed by, just to jump in, it's managed by District 4.
District who?
Sorry.
I know who it's managed by. I'm just not sure if it should go through DPW or if it should be addressed to Senator Tar, but I'll look
It can be addressed from the city directly to them.
Okay. Councilor Holmgren?
Nothing. Thank you very much, all of you. It looks like the mayor has her hand raised.
All right, we'll get to her in a minute. 1 second. Councilor McCarthy?
Yes, I'd like the mayor to mobilize the whole city IT department to investigate Barry's delay on his computer and get it fixed. That's it.
Oh, I know, right? Councilor Gilman?
Thank you. Can you hear me?
Yes.
Yeah, I had to move my computer. Request through the mayor that the mayor makes a request of the traffic commissioner to weigh in on the neighborhood request to install a do not enter sign on High Street and Hickory Street as approached from Young Ave. Second, request through the mayor that the mayor requests that the traffic commission reviews the signage needs at the corner of Andrews Street and Langsford Street approaching from Rockport in light of 2 skidding accidents in January and February 2021, where cars landed in the driveway of 10 Andrews Street. And I can provide all the backup material, but I just wanted to make those requests.
Okay.
Thank you.
And I don't have any requests. And Madam Mayor, you have your hand up?
Well, we'll do that. We'll get that. We'll ask them, because I heard Marianne Boucher and had concerns. And we also asked, from the last time from the Traffic Commission, I asked Chief Conley if he can get me how many accidents have been in that area, et cetera, for the past, and if they're looking like past 5 years. But I can ask through the Senator Char, myself, and we'll ask the state if they can come and look at it. Because sometimes it does break and they don't reset it. And if they can just do a small couple of days study to see how many cars go by, what the flashing needs, what can be green light, the whole thing, because at times it does delay and at times it just goes and there's accidents. So it's the lights. There's a lot to do with the lights and we have to have them fixed. So I'm going to have put in a request. Thank you, Councilor Cox.
Thank you, Mayor.
Can you also ask them to clean up after their accidents when they get done? Like, there's still a very large amount of glass at that intersection from the accident that required the jaws of life. And
Wow.
and bumpers, 2 or 3 bumpers at any given day.
All
If
right,
you
so-
see that, just put a request right away to the DPW, Melissa, Councilor Cox, because they can come clean it.
Okay, I just wasn't sure since it was state road that if our DPW or street sweeper, I hate for our street sweeper to get subject to that.
Our DPW is great because they know it'll cause other accidents. So if you leave a bumper, they really do a lot they're not supposed to do. But when it comes to safety, they're out there, so
Yeah.
they'll do it.
All right, thank you.
All right, so we concluded our council's request to the mayor. If there's nothing else, I will entertain, Councilor Nolan, did I forget you?
No, I just want to add something on the cleanup after accidents. That's definitely a issue with the towing company. The insurance companies do pay for that, and it's part of their description. There used to be a city contract that was gone out and gone over, and the chief of police was in charge of that. And Tallies is doing a horrible job at picking up, whether it be on the state roads or on our local roads. And we should have the mayor's office look into that with Tallies to make sure that they're doing their job.
Yeah, I agree. I mean,
They're
even on
allowed to do it,
128, when there's accidents, you see car parts all over the place and they're there forever.
So it's something we should
Yeah.
definitely look into with Tallies and the towing contract and Chief Conley.
Yeah, we'll
Okay.
do that, Sean, because DPW has been cleaning up everything. They get called at 1 o'clock in the morning when there's an accident and they go clean it because it's going to cause another accident.
Right,
Someone can get a flat tire and side swipe and it's terrible, but we do it. But you're right, we're not supposed to, but what are you going to do?
And enforce the towing. If they want to do the job, then make them do their job. If they don't, then you get
Right.
another.
I
Yeah,
agree.
revoke the permit.
Yep. All right, so seeing that there's nothing else, I will entertain a motion to adjourn.
So moved.
It's been moved
Second.
and seconded.
Not that I'm in a rush.
Councilor Memhard,
I'm going to object to adjourning.
Councilor Nolan,
Now we're all wishing Scott was on a delay.
Councilor Nolan.
Yes.
All right. Councilor O'Hara,
Yes.
Councilor Pat. Where is he? Barry.
Is he just messing with us?
Yes.
Thank goodness. Councilor
The night's
Cox.
still young. It's only 11:15.
We wasted 45 minutes waiting for Barry to answer a yes or no. Councilor Cox,
With 2% left of my iPad, yes.
Councilor Gilman,
Yes.
Councilor Holmgren,
Yes.
Councilor LeBlanc, yes. Councilor McCarthy.
Yes, good night.
All right, motion passes on a roll call vote of 8 in favor, 1 opposed. So Scott, you can hang out for a while, bud. We're adjourned. Good night, everyone.
Good night.